Yo, what is up? What is up, world? All right, I got to turn this brightness up. I don't know what's going on here. What's going on, everybody? What's going on? I got a little different kind of setup going on here. I got this fancy ass light right here. Check this out. Check this out. Boom. Oh shit, it's bright. All right, cool. Here we go. Welcome. I know I got a little different background setup here. Got a teleprompter. I got my other stuff over there. I got a whole bunch of stuff going on. So welcome. We are going live today. Today is Monday. So you already know what that is. Doing some motivational stuff. And of course, you already know we're about to get into doing these NCLEX questions. I'm gonna give y'all some time. Give y'all some time to jump up in here. Give y'all some time to jump up in here so we can get these questions started. Hey, if you're new here, my name is Kevin. I go by the Boot Nurse. Make sure you guys check me out on social media, all that good jazz. So I'm actually going to start trying to figure out how to pin stuff up in this live, but we're going to be going over NCLEX questions. We're going to be going over all kinds of stuff. So what I need for y'all to do is let me know who you are, where you're from, smash that like button. What up? What's up, ma'am? How are you? You already know you already know what we're doing today. You already know what we're doing today. So shout out to you for being up in here. Shout out to all 6 of y'all that have just joined me. If you're new here, I want to know who you are, where you're from, where you're at in your nursing journey. Hey, if you want a shirt, because everybody's a boot nurse and everybody is subject to hazing. I don't condone hazing. I'm just saying. So, I want to know who you are, where you're from, where you're at in your nursing journey. We're going to talk nursing, going to talk NCLEX. We're going to do NCLEX questions. I just want to get a bunch of people up in here before we start, because, sometimes these questions go by really, really fast. Smile, it's free. Hey, hi, how are you? Smiling is free. Avery, what's up? What's up, Avery? What happened? What's going on? Usually when people's like, guess what? Oh my God, I don't know what happened. So Avery, tell me what happened. Tell me what happened, Avery. Appreciate, who is that? Nina. I appreciate the follow. Thank you. Shout out to all 14 of y'all up in here. Hey, if you're new here, welcome. My name is Kevin. We're going to be going over nursing stuff. Hey, whatever questions you guys have, drop them down in the comments. I should have my co-hosts that are jumping up in here. So, your boy feels a lot better from that surgery that he had last week. So, knee still hurts, but, nowhere near as much as it hurt last week. So, we making it happen. I got offered my first nursing job in ICU. Shout out to you, Avery. Avery, you seem like you're very, like a very numbers gal. Like you're very, very black and white. There's no gray. You know what I'm saying? So I think that you'll do really well in the ICU. You're very, very on it. What's up, Linda? How are you? Hi, first year nursing student. I just passed my first nursing test today. Shout out to you. PP, shout out to you. Hey, you got a lot more exams that are coming up. You know what I'm saying? So keep the focus. You always thrive, but you always keep pushing. Y'all gonna do all right. So I'm going to give it a little bit more time. Shout out to y'all for smashing that like button. Hey, I'm just saying, y'all already know we're doing NCLEX questions today. So the more that y'all like, the more questions that y'all get. On average, I've been doing like 25. So you already know I want at least like 25,000 likes. But if your boy don't get it, he may just only do like 20 questions, or he may just only do like 15 questions, whatever. Shout out to all 17 of y'all. So I'm going to give it a few more minutes. So see if we can get a little bit more influx of people up in here. But if not, hey, I ain't gonna keep y'all waiting like that. You know what I'm saying? We're going to jump right into these questions. Your lives definitely helped me. Well, hey, shout out to you. Hey, so that's why I like to do these lives, because whatever helps. You know what I'm saying? Like, I wish that I had these lives, or I even wish that I even utilized social media like I did when, back in the day. Then maybe I probably wouldn't have had as much problems like when I was in school, or hell, when I was studying for NCLEX. So yeah. So, and here's another, I get this question a lot, all the time. Like, hey, is this a part of, is this for RN or for LPN? Hey, the questions are relatively the same. Hey, if you're an LPN, you just need to know what you need, what you can and what you can't do as a LPN. What are your roles and what are your responsibilities? As well as you need to know when you can't take specific patients and when you need to relinquish your responsibility of a patient if they go from stable to unstable. Okay. So shout out to Nurse Nelly. Nurse Nelly is my co-host. She just entered the room. Shout out to her. And like I said, we're about to be doing NCLEX questions. A little bit about me. My name is Kevin. I go by the Boot Nurse. Been a nurse for about 3.5 years. I've been in the Navy for almost 16 years. It'll be 16 years next week, actually. And I'm a master instructor. Been a nurse, like I said, for 3.5 years. Worked in the ICU, worked in the PACU, and worked in the OR. So I got a little bit of experience stuff. Hey, I failed my NCLEX 3 times, y'all. 3. 1, 2, 3. Uno, dos, tres. I'm not rolling my R's. Y'all know what I'm saying? So, hey, I failed my NCLEX 3 times. Y'all want to know? Y'all want to know why? Because I didn't have any direction. I didn't know what I was doing. You don't know what you don't know. And then by the time I got to my 4th exam, I found I had a good mentor and I kind of found my direction for myself. Hey, good study plan, time management, accountability, you name it, I had to fix it. All right. So new setup. No, I just kind of moved from one computer to the other because the way that my knee is set up and the surgery, all that shit. You know what I'm saying? So, hey, if you're new here, I want to know who you are, where you're from, where you're at in your nursing journey. Let's foster a really good environment down there in the freaking chat. Nurse Nelly is my moderator. She's been a nurse for 4 years. Yeah, 4 years, right? 4.5 years or so. Worked in ICU, worked in med surg, worked in tele, now does case management, loving her life. I'm just saying, y'all act up, she gonna ban y'all. Adriana. Oh, it's you. Oh, Lord have mercy. Lord, give me the strength. Did you have to go in front of a board of nursing to ask for a 4th chance? No. So I went to school in Texas and you have 4 years to get your nursing license. Yeah, you have 4 years to get your nursing license within that time frame. After that, you have to go in front of a board, or you have to write a letter or something along those lines. And then they'll give you another chance. And then if you don't pass it at that point, then they make you go back to school. I've never heard of anybody doing that. I just know that that's how a process is. So never heard. I personally don't know anyone who has went through that. I probably should read up on an article. I'm pretty sure there's something that's out there. But anyways, we got like 70 something people up in here. You already know what the deal is. Hey, I apologize for Friday. Your boy was just, it was high as a kite. You know what I'm saying? All them drugs that they gave, boy. So we good. But without further ado, I'm going to turn this camera around so y'all don't got to look at me. Y'all can look at this computer and we're going to jump in to these questions. But like I said, I want to know who you are, where you're from, where you're at in your nursing journey. Make sure you guys smash that like button and make sure you guys share, because you have no idea who this is going to, who this is going to benefit. All right. So I think everybody can see that. I'm going to bring that down some. I think everybody can see that. I want to make sure stuff is not all up in the way. Is that Tanja, 30 years CNA, 20 years CMA, RN school. And hey, shout out to you. Shout out to you. Shout out to you. Shout out to you, Lori. RN for 30 years. Lord of mercy. Nicole, Las Vegas, graduated in December. That's what I'm talking about. Graduation on the horizon. That's what I'm talking about. Okay. All right, cool. Hey, while y'all are down there doing your thing, like I said, make sure you guys shout out the answers. I love participation. Make sure you guys share. Make sure you guys smash that like button, okay? We're doing NCLEX questions. And if I'm talking too fast, blame the Zients that I had earlier, because your boy is on it. Participation. I love to, hey, I need y'all's participation. I need it. Need it. You feel me? So, I'm kind of sort of not really, but really funny. It all just depends on you and how I represent myself and how y'all already know what the deal is. Hey, the more that y'all like, the more questions that y'all get. That's just as easy as it gets. Hey, we got 25 questions. Yeah, so I want at least 25,000 likes. Make it happen. If you don't make it happen, you ain't getting no more questions ever in life. No, I'm just playing. We're going on to the next one. Hey, so for those that don't know, I created an NCLEX course. Why did I create the NCLEX course? Hey, if you're new here, remember, I failed my exam 3 times. So the main reason why I created this is that I don't want anyone else to feel how I felt. I don't want anybody else to feel like they're a failure, that they're not good enough to be a nurse, and that they can't accomplish this goal. You feel me? So I created it. I created it based off of what I would think, what really helped me, and what really I know truly what could help other people. That link is in my bio. It's going for $48. It's in its pre-launch phase, so we're continuously adding stuff. NGN questions and stuff like that are being created as we speak, and those are getting taken care of and going to be uploaded here shortly. Not shortly, like as in like after this live, but shortly here within the next couple of weeks. So as long as you guys are patient with that. Yeah, hey, so don't troll my chat. Caitlin says, when does he actually start doing questions? Well, Caitlin, I like to do a lot of housekeeping, because if you don't understand the rules, then you'll get a 600. You're about to find out. All right. So don't troll my chat. You troll my chat, you're going to get a 600. That's all that is just a ban. All that is just a ban. You come into my chat acting a fool, I'm going to ban you. All right. And I don't gatekeep. I got these questions off nurselab.com. I'm not going to sit here. Okay. G Money. Goodbye. You don't got to sit here then. He about to miss the questions anyway. You know what I'm saying? Goodbye. Oh my God. Hey, And I also do this on a democracy. I just want to let y'all know that I also do this on a democracy. If anybody's acting up in the chat, legit, and you want to give him a 600, let me know. Or Nurse Nelly will give him a 600, whichever. You already know, whatever floats your boat. All right, here we go. Question number 1. A 16-year-old patient with cystic fibrosis is admitted with increased shortness of breath and possible pneumonia. Which nursing activity is most important to include in the patient's care? Is it A, perform postural drainage and chest physiotherapy every 4 hours? Allow the patient to decide whether she needs aerosolized medication, place the patient in a private room to decrease the risk of further infection, or is it D, plan activities to allow at least 8 hours of uninterrupted sleep? Oh, we got C's, we got A's. What else we got? Avery says A. All right, cool. All right, cool. We got some C's, we got some A's. Okay. All right. All right. A or C? Is it Liliana? Ma'am, you got to pick one. You got to pick one. PP says A. There's only one A. Only one. Only one. Hey, make sure you guys share what I think. What's it? Wait, I think A. Hey, so here's the thing. What is E? E is not even an option on here. What are you talking about? Cassie says A. Abby says A. Nay says C. Ileana says A. Or Liliana, not Ileana, sorry. All right, cool. All right, cool. Hey, I'm going to give you guys about another 15 seconds. I know some people are just like, oh my God, he takes too long. Go to the next question. Bree says C. Okay. All right. Is this Chanel? Okay. Alexa says A. Kim says C. Okay. We're kind of like all over the place. We got some C's. We got some A's. All right, cool. Let's see what the answer is. The answer is A. Airway clearance techniques are critical for patients with cystic fibrosis and should be or should take priority over other activities. Sorry if you guys hear my son. I don't know what he back there screaming for. He got something going on. The cystic fibrosis transmembrane conductance regulatory defect causes mucus to become dehydrated. Secretions in cystic fibrosis are generally thick, sticky, or more difficult to clear. Frequent airway clearance is a mainstay in the treatment of acute exacerbation, as well as an integral part of health maintenance of cystic fibrosis. Hey, I know that's a mouthful. Got to clear that junk out. That's right. I know that is a mouthful, but here's one thing I need for everybody to understand is that even if you got this question wrong, you always need to read the rationale. You need to see why it's right. And then if you picked one of these answers, like option B, C, or D, obviously there's no E here, but what you need to do is that you need to read these answers to see why that answer is incorrect based off of the correct answer, because you have no idea about 5-10 questions later on down the line. You have no idea if that type of question will pop up. All right, cool. Maybe 3 or 4 or 5 times a day, not every 4 hours. Yep. Not private room, not cohorted. What does it say? Airway, breathing, circulation, right? Hey, so sometimes ABCs may not be the best option, right? What about a level of consciousness, right? That could go above ABC. It all just depends on how the question is worded. Okay. All right. Well, it looks like we're talking about a lot of pulmonary and lung right now, even though we're on the second question. All right. So here we go. A patient with a pulmonary embolism is receiving anticoagulation with IV heparin. What instructions would you give the nursing assistant who will help the patient with activities of daily living? All right. Shout out to everybody for the follow. So here's one thing is that this is a delegation question, right? The disease process is that somebody has a pulmonary embolism. So what can I delegate to a UAP as the RN? And this is select all that apply. So remember, it's more than one. So that says dot says BCE. Okay. BCE. Okay. What else we got? What else are we thinking? BCE. Okay. ABCE. Imani. Is it Imani? Okay. Got it. BCE. Okay. All right. I'm gonna give you guys another 15 seconds. ABCE. Okay. Is it possible you can zoom in a tad? It's not. If it's not, it's cool. Let's see. So if I zoom in on my end, it's going to look like you're not going to be able to see all the answers and all the questions. So, all right, cool. Let's see. We got like a lot of BCE. So let's see what we got. So it's A, B, C, and E. All of the other instructions are appropriate to care for a patient receiving anticoagulants. Risk for bleeding may arise in any condition that disturbs the closed circuit integrity of the circulatory system. Bleeding is the primary complication of anticoagulant therapy and is a risk of all anticoagulants, even when maintained within the usual therapeutic range, right? So remember, anticoagulants is like, you got to think about safety, right? So one of the answers on here was use an electric razor, right? We don't want to use a regular razor for their chances of bleeding, right? We want to use soft bristles instead of medium or hard because of the oral bleeding that they're going to have or possibly could have, right? All right. All right, cool. Make sure you guys keep smashing that like button. Hey, make sure you guys share. You never know who's going to need it. All right, make sure you guys share. All right. Hey, and if you guys are new here, welcome. It kind of cut off at the end. What are you talking about, Avery? Talking about this part? Oh, down here at the bottom? Yeah, it's kind of cut off at the bottom. All right. All right. So shout out to all y'all. Like I said, make sure you guys share. Hey, if you guys are new here, we're doing NCLEX questions. I'm going to try to back it up some. I know it looks kind of small. And I'll try to bring this down some. Let's see. Get this to work. Come on, MacBook. You don't want to work? Whatever. Fine. All right. Here we go. All right. A patient with an acute respiratory distress syndrome is receiving oxygen by a non-rebreather mask, but the arterial blood gas measures still show poor oxygenation. Is the nurse responsible? Oh, I'm sorry. As the nurse responsible for this patient's care, you would anticipate a physician order for what action? Is this for RN or LVN? So these are essentially pulled for RN, but in regards to content, all our RNs and LPNs essentially have to know the same exact thing. So one thing I said before we started is that if you're taking the LPN or the PN NCLEX examination, is that you need to know what your role and your responsibilities are and what you can and can't accept in regards to your scope of practice from an RN. Get them mechanical ventilations, y'all. So we got B, B, B. Somebody say A up in here. Leslie said A. Adriana said A. Okay. Isn't a non-rebreather the highest you can give before you intubate? Yeah, but you also have to think about what is our patient doing, or what is going on with our patient. So a patient with acute, right, respiratory distress, right, who is already receiving oxygen via a non-rebreather. So they already have it, but their ABGs are showing that they're having poor oxygenation. As a nurse responsible, you would anticipate a physician order for what action. So, hey, your doctor's going to come in here and be like, hey, we need to do this action, right? You need to tell me the MD to get RT down patient room. What? Hey, RT's not in here, but intubation, let's go get the RT, right? Okay. All right. I think everybody got a general consensus. Some people are saying B. Some people are saying A. Nobody said D because, hey, remember in NCLEX world, Adriana says A. In NCLEX world, you have everything. You have everyone. Right. And you also have the order. So, hey, anticipate that. What's the next order that's coming? All right. Here we go. All right. I don't know what happened here. Here we go. And the answer is A. Perform endotracheal intubation and initiate mechanical ventilation. A non-rebreather can deliver nearly 100% oxygen, right? When the patient's oxygenation status does not improve adequately in response to the delivery of oxygen at this high concentration, refractory hypoxemia is present. Usually at this stage, the patient is working very hard to breathe and may go into respiratory arrest unless healthcare providers intervene by providing intubation and mechanical ventilation to decrease the patient's work of breathing. I said decrease. Decrease, y'all. Decrease. Shout out to all 300 plus of y'all up in here. I appreciate everybody. Make sure you guys share. Make sure you guys follow. Hey, I need 10,000 likes. I need 10,000 people to follow me so I don't got to be ghetto and do this on the computer like this. Because, phone, computer. All right. So what did I say? Intubate. Yeah, you did say intubate. All right. I'm trying to catch up on some of y'all's questions shared with my whole cohort. Shout out. Hey, share to the whole cohort. Tell the cohort to come up here. We rocking. All right. All right. Here we go. Question number 4. The nurse is caring for a client with chronic obstructive pulmonary disease or COPD. Which intervention for airway management should you delegate to a nursing assistant or the UAP? Is it A, assisting the patient to sit up on the side of the bed? Is it B, instructing the patient to cough effectively, teaching the patient to use an incentive spirometer, or auscultate breath sounds every 4 hours? Everybody's saying A. Tristan says D. Tristan says D. Now, so think about this. Like, what is the scope of practice for a UAP? No assessment, no teach. So how does the old saying go? We can't do what? We can't do what as we eat? We can't do what as we eat? CNAs can't do that. Okay. Definitely A. Okay. Can't teach. Some people saying C. Some people saying B. Can't auscultate, assess, abnormal symptoms. Can't delegate. There you go. Can't delegate what you eat. Right. There you go. All right. I think we got somebody says B or C. Okay. No, they can't assess. Okay. All right. What's the old saying? Is like you can't delegate what you eat. Y'all let them know down in their chat. You can't delegate what you eat. What does eat stand for? Here we go. Here's our answer. All right. It is A, assist the patient to sitting up on the side of the bed. Assisting patients with positioning and activities of daily living is within the educational preparation and scope of practice of a nursing assistant. Some examples and tasks and aspects of care that can be delegated legally to non-professional, unlicensed assistive nursing personnel, provided they are competent in these areas under the direct supervision of the nurse, include assistance with transfer, range of motion, feeding, ambulation, and other tasks such as making beds and assisting with bowel and bladder functions. There you go. Hey, I appreciate the follow. Thanks so much. Shout out to all 300 plus of y'all up in here. We rocking. Hey, my name is Kevin. I go by the Boot Nurse. Make sure you guys give me a follow. Hey, the more people that follow, the more unghetto I can be, and I can, stream over here. So I think everybody has a general consensus, right? I think everybody has a good general understanding about this question and how we're rocking with it. All right. So let's go on to the next one. All right, here we go. Question number 5. A patient with sleep apnea has a nursing diagnosis of sleep deprivation related to disruptive sleep cycle. So all my people that are in their first year of nursing school, where you're going through fundamentals, learning about nursing diagnosis, hey, this is right up your alley, right? Which action should you delegate to the nursing assistant? Is it A, discuss weight loss strategies such as diet and exercise with the patient, teach the patient how to set up the BiPAP machine before sleeping, remind the patient to sleep on his side instead of his back, or administer, Provigil to promote daytime wakefulness? Everybody says C, because who can teach? RN or LPN, right? Who can teach? Because you are reminding, not initiating, telling the patient. Yep, as the RN's job. Facts. CNA can't administer meds. RN, that's right. All right. They cannot administer meds. Yeah, I'm tracking. I got you. RN. Initiate teaching must be done by the RN, right? Initial teaching must be done by the registered nurse, right? And then everybody else under the registered nurse can reinforce what that RN has said or what that RN has taught to the patient, right? So here we go. Wait, what's my answer? There's my answer. There's my answer. So the answer is C. You're in nursing school. Shout out to you. Wise damsel? Wise damsel. Man, I don't know how to read. Shout out to y'all. So the answer is C. The nursing assistant can remind patients about actions that have already been taught by the nurse and are part of the patient's nursing care plan. The right person must be assigned to the right task and job under the right circumstances. The nurse who assigns the tasks and jobs must then communicate with and direct the person doing the task or job. The nurse supervises the person and determines whether or not the job was done in the correct, appropriate, safe, and competent manner. Remember, the RN is responsible for everything. So if I delegate to a CNA or if I delegate to a tech and they don't do it right or they don't do it at all, ultimately, me as the RN, I am the one who's responsible for it. And best believe, if I give you a task and you don't do it, we gonna have a couple words. And they're probably not going to be real good words for you, you know what I'm saying? Especially if you told me not to do something, so I'm just saying. Anyways. All right, so shout out to y'all. Hey, we're going to take a little break. And by a little break, we do these little interludes, right? Every about 5-10 questions, just so I could get everybody caught up. Hey, we're doing NCLEX questions. If you don't know, my name is Kevin. I go by the Boot Nurse. Make sure you guys check me out on all social media platforms. Make sure you guys participate. Answer those questions. Answer those questions down there inside the chat, right? Participation is the key. I'm kind of sort of funny, but not really. The more that you like, the more questions that you get. We got 25 questions right here, but hey, the more that you like or the more that you dish out, hey, the more questions that you get. I'm just saying. I created an NCLEX course, 7-day NCLEX course. That link is in my bio. Check it out. Once you buy it, it's yours forever. It's $48. It's in its pre-launch phase. So yeah, make sure you guys check that out. Hey, don't troll my chat. Don't rush me in my chat. Don't troll my chat. If you troll my chat, you're going to get a 600. What's a 600, you may ask? That's 600 seconds, which equals 10 minutes. And that's how long I'm going to ban you if you come in here acting a fool. And I also do it on a democracy as well. So if anybody come in here and start acting stupid and y'all say, hey, Kev, give him a 600. I got you. I'm giving them a 600. Also, I don't gatekeep. I got these questions off nurseslabs.com. If you guys have never been there, it's a really good website where they give free questions as well as talking about nursing diagnosis and all that good stuff. All right. So I'm going to try to catch up on some of y'all's questions because, man, y'all be asking a ton of questions up in here. And then we're going to jump in to the next question. OP, y'all hear him? Hey, look, let them know. I literally just passed my NCLEX PN on my second attempt after 2 years. You helped a lot. I appreciate you. I'm glad that it was helpful for you. I really, really do. Nurse Lab, straight up. Yo, what's up, D? One time I'm going to come in acting wild is when I pass my NCLEX. All right, Adriana, you can come here and act wild all you want. So where do babies come from, bro? Well, when two people fall in love, well, actually, they don't even have to be in love. So you already know how that goes. All right, here we go. Question number 6. Hey, I love y'all. Y'all Gucci out here. Do you always share resources for studying we can always use? Absolutely. I don't gatekeep. I'll tell you everything that I used on top of the NCLEX course that I created. I don't gatekeep. You want to know why? Because everybody got to eat out here, even if it ain't at my table. And that's real. Hey, make sure you guys follow. Make sure you guys share. Smash that like button. Y'all stop playing games with me. All right, here we go. Question number 6. After a change of shift, you are assigned to care for the following patients. Which patient should you assess first? AKA, who's gonna die if you don't see them first? Think about it like that. Who's gonna die if you don't see them first? All right. Is it a 60-year-old patient on a ventilator for whom a sterile sputum specimen must be sent to lab? Is it a 55-year-old with COPD and an O2 saturation on the previous shift of 90%? Is it a 70-year-old with pneumonia who needs to be started on IV antibiotics? Or is it a 50-year-old with asthma who complains of shortness of breath after using a bronchodilator? Sparkleberry jam. Is that a real thing? Sparkleberry jam? Is it? Because if it is, I kind of want some. D, B or C. Starboy says B or C. Okay. We got some D's. Brianna says C. Airway, D. A or D. Hey, you got to give me an answer. Hey, remember, think about this. So here's the thing. What's stable versus unstable? Right? Stable versus unstable, acute versus chronic. What are my expected outcomes versus my unexpected outcomes? Right? Think about that. Oh, somebody said a bad word in my chat and it blocked you. All right. First, airway. Airway is the priority. All right. So if airway is the priority, what are we looking at? Bronchodilator, COPD always has a low O2. Okay. Shortness of breath after the bronchodilator. Don't block me. What'd you say? Oh, D said something? Okay, I ain't gonna block you. Hey, you already know what the deal is if you get a 600. You already know. Once you block forever. I don't play that nonsense. All right, I think we got a general idea, right? Think about it. Stable versus unstable, acute versus chronic, right? Somebody already said something about B, right? All right, here we go. Here's our answer in 3, 2. The answer is D, a 50-year-old with asthma who complains of shortness of breath after using a bronchodilator. A bronchodilator is supposed to help you breathe, right? But then again, it's not. It's not doing what it's supposed to do. What's B's baseline? Didn't ask you that. Everybody was like, oh, what's the baseline? Didn't ask you that. Did not ask you that at all, right? Do not put more into a question, because if you put unneeded information into a question, you are going to get the question wrong. You are going to get it wrong. If you don't read your question, you're going to get the answer wrong. Read RTFQ. Y'all tell me in the chat right now what RTFQ means while I read this rationale. A patient with asthma did not achieve relief from shortness of breath after using a bronchodilator and is at risk for respiratory complications. These patients' needs are urgent. In particular, a patient who is chronically on short-acting beta-2 agonists risks not achieving the same relief from their medication as they once did. This phenomenon is known as is receptor downregulation. It happens because a portion of the receptors targeted end up being inactivated by the body due to overuse. Hey, you use it all the time? That's what happens. Use it all the time? That's what happens. All right? Y'all, look, hey, I don't even know. Second would be antibiotics. Hey, I didn't ask you second. I'm asking you first. Avery knows the deal. What's RTFQ? Y'all, I don't know. Avery said it in the very PC way. Christy said it in a really PC way, too. You already know how I'm going to say it. You already know I've been an instructor for a long time, and I say that exact, the way that you think is the way that I say it, right? So I'm going to go back. Remember, somebody COPD, keyword there's chronic, right? Somebody with a chronic, issue right here, their normal O2 saturation is going to be that way, right? Somebody who has asthma, okay, that's an acute thing. We're having a breathing issue, but they already got bronchodilators. For people that don't understand, right? They got bronchodilators. This is to help them breathe, but they didn't get relief from this because they still have shortness of breath. So that is a person I need to check on. Somebody who's 60 years old on a ventilator, that's not urgent. That's not urgent. You see what I'm saying? So this person would be the person I would want to see first. They didn't ask you to see who's second. They didn't ask you to see who's third. I want to know who you see first. Okay? Remember, who's going to die? I don't know why I said it like that. Who's going to die if you don't see them first? All right? Here we go. Question number 7. After the respiratory... Hey, shout out to all my RTs. After the respiratory therapist performs suctioning on a patient who is intubated, the nursing assistant measures vital signs for the patient. Which vital sign value should the nursing assistant report to the registered nurse immediately? Hey, if I don't report this to the RN, my patient's gonna die. Right? Think about it like that. You got a heart rate of 98, a respiratory rate of 24, a blood pressure of 168/90, or a tympanic temperature of 101.4. B, baby. Okay, D, I see you. I see you, girl. I see you. All right. It was a Filipina, Italian. Okay, that's a lot going on. Filipina, Italian, Italy. Oh, my God. Obviously, I don't know how to read. You say, okay, what'd you say? You said C, B, B, C, 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 B, C, B, 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 B. Christy. Hey, it's either or, ma'am. It's either or. Either or. Robin says C. Robin. Okay, Robin says, Robin, I see you. I saw your name pop up here. I seen you. All right. Meg says C. Celeste says, I say D. Okay, Celeste. Joe says B. Okay. Is it Maya? Maya is, I don't even know. Nikita says something because now it's gone. Oh my God. B, D. Okay. Hey, remember, I'm a big proponent of doing these questions. Hey, don't feel bad if you get these questions wrong. I know a lot of people get real down in the dumps about the fact of how they get all the questions wrong. I would expect for you to get all the questions wrong at the beginning, right? But a month from now, I would not expect for you to be getting these same questions wrong. All right. This is why you have to practice. OK, this is why you have to practice. Respiratory rate at 24. What's the normal respiratory rate? Right. What's the normal respiratory rate? What's our normal blood pressure look like? What do I need to look for? Remember, you have a patient who's intubated. Paint that picture. Paint it. Paint the picture. Right. That blood pressure hella high. OK. OK. So think about it. Think about a patient who is intubated. And a CNA or a UAP is taking vital signs on them. What do you want to know as the nurse, right? What do you want to know? All right. I think I've been on this long enough. I'm ready to read this rationale. Here we go in 3, 2. And the answer is D, the tympanic temperature of 101.4. I know y'all are just like, oh my God, why, what? Jenny said like, what? Celeste, you got it right. That's what I'm talking about. Here we go. Check this out. We're going to read the rationale. This is why it's so important for you to read it. Infections are always a threat to a patient receiving mechanical ventilation. the endotracheal tube bypasses the body's normal air filtering mechanisms and provide a direct access route for bacteria or viruses to the lower part of the respiratory system. So my patient has 101.4 temp. So it has me thinking, okay, maybe they're about to get, mechanical associated pneumonia, right? Mechanical associated pneumonia, which I worked in the ICU for a little over a year. And trust me, it happens. It happens this is why suctioning and maintaining, those clean techniques around somebody who is trached and who is intubated is so important. Yeah. Ventilator assisted, or associated pneumonia. I'm sorry. Oh my God, I can't believe I missed it. Why not, Bailey? It's okay. Damn, I wasn't even thinking about, there you go. That's why I said, you guys will hear me say the term paint the picture, right? Because all that information is given to you. Okay. And this is why it's like, hey, if you know that you're not doing well in a specific area, maybe I need to look up. I need to spend maybe, another 15, 30 minutes looking up something more specific in that area. Okay. I get why the answer is D, but the blood pressure should report immediately also. I don't disagree with you, but let's read the rationale. Avery, since you brought that up, let's read the rationale. And it was talking about blood pressure, right? And I think it was A, if I was right. No, it was C. So C, the blood pressure is an essential vital sign to comprehend the hemodynamic condition of the patient. Unfortunately, though, there are a lot of interperson variables, we'll say variables, when measuring it. All healthcare providers should be aware of making sure all the essential prerequisites are met before checking the blood pressure of the patient. That may not be the answer you want to hear. That may not be the answer that you want to hear. The blood pressure is a result of sepsis. Yes, but here's the question. If a patient is septic, would their blood pressure be 168/90? I do these lives Monday, Wednesday, Friday, 5:30. No, they would have a low blood pressure. They would be hypotensive. They would not be hypertensive. Exactly. That's what I'm saying. This is why it's important to read the rationale. And I'm telling you right now, you may not agree with this, and that's okay. I could give you 100 questions. There could probably be 5 to 10 that are just not good, right? But that doesn't mean that the rest of them are bad. Okay, just think about it. Just think about it on that aspect. OK, also, wouldn't it be considered ABCs? Yes, it could be. It could be. But is there anything in here that constitute the fact? It could be ABCs, right? But 20 to 24. This is why I said it's super important. It said the normal breathing rate is about 12 to 20 breaths per minute in the average adult. Tachypnea is described as a respiratory rate of being more than 20. That could occur in physiological conditions like exercise, emotional changes in pregnancy, pathological conditions like pain, pneumonia, pulmonary embolism, asthma, foreign body aspiration, anxiety conditions, sepsis, carbon monoxide poisoning, and diabetic ketoacidosis can also present with tachypnea. Okay, I got it. This is why I'm trying to tell you. This is why it's so important for y'all to read the rationale. Shout out to all 359 of y'all up in here. Yo, I appreciate y'all. All right, here we go. This one's for my LPNs, right? As an experienced LPN, under the supervision of the team leader RN, is providing nursing care for a patient with a respiratory problem. Which actions are appropriate to the scope of practice of an experienced LPN? Select all that apply. I think it's B or A, B, and D, A, B, E. Lizard King. Adriana says not C. Okay, well, I got you. It's not C. You want to know obstetric stuff? Well, we're not doing obstetric stuff today. Never do eat for LPN. Okay. I switched my degree from LPN and we have similar boards. Shout out to you. All right, what are we thinking? Ariel says B and E. Is that a roach? Oh my God, do you have a roach like as your name? He says ABE. Oh my God. Hey, make sure you guys follow. I need all the follows I can get so I don't, I could be unghetto and, like stream from like my computer. All right, cool. I'm gonna give y'all about another 20 seconds. Right. So think about what can an LPN do? Can an LPN initiate a care plan? Can they evaluate a patient? Remember, they're under the supervision of the RN. What can they do? Right? Today was the first day of nursing school, A and B. Okay, shout out to you. Today is Monday, huh? In real life, they do everything. Well, I didn't ask you about real life, Lily, because, hey, that's another thing. If you guys are out here working in real life, don't do that because you will not do well on that exam. And it doesn't. So the NCLEX for LPNs and RNs are on a national level, and they're all the same. So it doesn't matter what you do state by state. Does not matter what you do state by state. I'm going to give y'all 10 more seconds. NCLEX world is totally different. Facts. It is perfect world. I'm trying to tell you, you could be IV certified and all that other good jazz, but according to NCLEX, you are not IV certified. You are not. I don't care what state you come from, because a state exam does not trump a national exam. All right. Oh, and here are your answers, A and B. Oh, look at me. I'm over here answering questions. You know what I'm saying? Oh, all right. Let's see. Appropriate decisions relating to the successful assignment of care are accurately based on the needs of the patient, the skills of the staff's position description or job description, the employing facilities, policies and procedures, and legal aspects of care, such as the state's legal scope of practice for nurses, nursing assistants, and other members of the nursing team. Never second guess yourselves, ever. Don't ever do that. Because 9 times out of 10, the very first answer that you picked is the correct answer. 9 times out of 10. Can I see the question again? No, Connie, we're going on. We're not going back for you. All right. What you think this is? You think this is an on-demand thing for y'all? The hell, y'all? All right, we'll go back. Oh my God. Hey, I'm just playing. Hey, shout out to y'all. We got 500 plus people over here, y'all. We got 500 plus people. Hey, I appreciate y'all. Make sure you guys like, share, follow. Hey, I'm kind of funny sometimes. You know what I'm saying? Don't be coming in here demanding stuff. Hey, give me a smile. It takes nothing to be nice. You know what I'm saying? Don't come in my chat trolling because I'm going to give you a 600. You needed this. Thank you. Hey, cat eyes. I got you. All right. All right. Here we go. Y'all done reading? All right, cool. Here we go. This is fundamental. So I'm happy to be here. Hey, don't get it twisted. On your nursing exam, you have fundamentals. Fundamentals is embedded into everything, into management of care, into pharmacology, basic care and comfort. A reduction in risks, like physiological adaptation. It's everywhere. It's everywhere. All right. The charge nurse is making assignments for the next shift. Hopefully she doesn't give you a shitty one. Which patient should be assigned to the fairly new nurse, which is about to be a bunch of y'all, pulled from the surgical unit to the medical unit? Is it A, a 58-year-old on airborne precautions for tuberculosis? Or is it B, a 68-year-old just returned from a bronchoscopy and biopsy? A 72-year-old who needs teaching about the use of an incentive spirometer? Or is it D, a 69-year-old with COPD who is ventilator dependent? All right, y'all already answering. Y'all ain't even gonna let me finish. All the above? Ma'am, that ain't it. Where do you see all of the above? Come on. Anthony said novice nurse. Hey, we all novice nurses out here. We all boots. We all babies. Whatever. What is that? It's a Girlina Coma 13. Look, over here saying all the above. What do you think this is? A Mayno song? Choose the most stable. So we got to think. It's just like, you got to think of like, okay, if I'm going to send you to another floor, right? If I'm going to send you to another floor, you need to be able to do what the basic nursing care is, right? I should be able to send a nurse that is either 6 months from surgical. I should be able to send that nurse to labor and delivery, and they should be able to do the minimum things that are required for a nurse. It doesn't matter what floor I put you on. Now, it'd be different if I was just like, hey, I'm taking you from surgical and I'm going to put you on the ICU. That's a totally different story. Have you given what? Nope. Is this a part? It is part of the nursing process. Look at that. Hey, I'm gonna give y'all 15 more seconds. I know y'all don't answer, but we got some B's, some C's, some A's. If she came from surgical to med surg, give her a B. Okay. No C. Oh, okay. Demanding much. LPN can administer meds, right? They can administer meds. What medications can an LPN, a licensed practical nurse, what medications can they administer? Let me know right now. Let me know right now. I want to see my chat just blown up. All right, PO. Okay, what else? What else besides PO? All except IV. All but blood products and titration meds. Nothing but IV. So, hey, PO meds. IM meds. They can't do blood products, right? They can do subcutaneous. So here's another one. Can they hang antibiotics? Whoop, whoop. Shout out to y'all. So the answer was C. And why y'all no IV drips too. Hey, look. So now let me rephrase that. Can they hang the first bag of antibiotics? There you go. It can't be the first one. They can't start it, but they can do the second one, right? So my son's favorite word is two. So I'm like two, right? Oh, I'm silly, y'all. All right, here we go. Hey, so who was it? It was teaching a 72-year-old how to use an incentive spirometer. Many surgical patients are taught about coughing, deep breathing, and the use of an incentive spirometer preoperatively. The needs of the client must be competently met with the knowledge, skills, and abilities of the staff to meet these needs. In other words, the nurse who delegates aspects of care to other members of the nursing team must balance the needs of the client with the abilities of those to which the nurse is delegating tasks and aspects of care. That was a mouthful. In reality, is saying like whatever your scope of practice is, I need to be able to give to you. So if you come to the ICU, I'm not going to give you a ventilated patient on 8 drips. Let me tell you something. That is terrible. That is a terrible thing to do. What about PICC lines for LPNs? Hey, y'all answer that question for Dana. Can LPNs do anything with PICC lines or central lines? It's funny because I just did not a review, but I just did a lecture on central venous access devices, right? I just did that before I got on this live. No, the answer is no. The answer is no. Dana, I hope that answers your question. Right? In Alabama, no. I didn't ask you about in Alabama. Remember, this is in NCLEX. We're not on state level. We're on national level. They can in nursing home settings. I didn't ask you that. You're right. They can, but I didn't ask you that. Can they do insulin? Of course they can do insulin because insulin is given how? No PICC line. Correct. Insulin is given how? You can't see the full question. Where the percent? What you mean? Oh, is it better? See, on my end, it looks a little bit better. I'm going to back it up some. Is that better? Sub-Q. And long-term care facilities, they can pull a PICC. I didn't say anything about long-term care facilities. Hey, so everything that you're learning when it comes to your licensing exam, they don't ask you anything about being in a long-term care facility. If you're IV certified, they don't ask you none of that. You can't do it according to your exam. You cannot do it. I'm telling you right now, don't be like me and be hard-headed. Trust and believe me when I tell you that. All right. So here we go. The high pressure alarm on a patient's ventilator goes off. Right. When you enter the room to assess the patient who has ARDS, the oxygen saturation monitor reads 87 and the patient is struggling to sit up. Which action should you take first? Reassure the patient that the ventilator will do the work of breathing for you. I don't know. I'm sorry, y'all. I don't know why I'm laughing. Manually ventilate the patient while assessing possible reasons for the high pressure alarm. Is it C, increase the fraction of inspired oxygen of the ventilator 100% in preparation for endotracheal suction? Or is it C, insert an oral airway to prevent the patient from biting on the endotracheal tube? Man, we got a lot of stuff going on up here. A, because why are you trying to sit up? Whatever happened to the position of comfort, right? Whatever happened to the position of comfort? I'm answering that specific question because I thought that was funny. Assess patient first before the machine. This definitely not A. If patient freaks out, ain't nothing gonna help. That's true. Some things can help, but I mean, think about it. If you had a tube stuck in your throat and you're just like, hey, calm down. I'm gonna remember that. B. Avery said B. I think this is a hard one. Haven't learned about ventilators yet. Hey, ventilators are cool. I actually like the ventilators. Never C. What you mean? Okay, you're right. We're not in an ICU setting, so we can't do that. Get the restraints. Sir or ma'am, that is not what we do. 4 points. Oh, my God. We do not go straight to the restraints. It does not fix the problem. All right, so what are we thinking? I'm going to give y'all 20 more seconds. I'm going to give y'all 20. Get the restraints. Oh, my God. All right, here we go. Shout out to Candace. Thank you for the follow, Candace. I appreciate it. Who else followed me? Is that Jessica? Jessica Ward. Hey, I know a Jessica Ward. I went to school with a girl named Jessica Ward. I wonder if it's the same one. It can't be B. All right, well, Hannah, is that Dion? Hey, I appreciate the follows, man. Y'all Gucci out here. All right, here we go. We're about to answer in 3, 2, 1. And the answer is B, mechanically ventilate the patient while assessing possible reasons for the high pressure alarm. Manual ventilation of the patient will allow you to deliver a FiO2 of 100% to the patient while you attempt to determine the cause of the high pressure alarm. Proper ventilation techniques with the BVM, and if you don't know what a BVM is, that's a bag valve mask. It's the one that has like the big old blue thingy on the side, the pump, right? Should consider safe ventilation parameters for each individual patient and their conditions. Okay. How we feeling about that? Y'all let me know. Hey, if you guys are new here, welcome. My name is Kevin. I go by the Boot Nurse. Been a nurse for, I don't know, since breakfast, as some people like to tell me. But we're doing NCLEX questions. Make sure you guys like, share, follow. I need more follows than anything, but I need y'all to smash that like button. I need it. I need it right now. It's almost always an answer that has a word assess in it. It depends. So here's another thing. It's like, do you assess before you implement? Because some things don't require you to assess. They'll give you enough information in there to be like, hey, I need to do it. I need to do it right now. Now I said, I love this help. I love it. This helps a lot since I started fundamentals class. Okay, shout out to you. As an RT, we never do this 100% suction. And look, ma'am, look. I ain't teaching RTs. All right. I ain't gonna lie to you. I literally had an RT teach me about the vents because that's all y'all do. Shout out to the RTs. Legit. For real. I've been saved in many codes from a respiratory therapist. I'm just keeping it all the way real. What you mean not real world? I don't know what you're talking about. Farmer's daughter. I don't know what you know. I just learned about this today. It's stressing me out. Well, don't get stressed out about it now. Don't get stressed out about it. Great testing gems. You're starting. Hey, look, that's what I'm all about. I don't know who's calling me from Ohio, but I ain't answering it. It's probably somebody telling me about my car's extended warranty. Hey, shout out to y'all. Hey, so little break here. Hey, don't y'all go nowhere either. Don't y'all, we can't answer off real world. That's right. You cannot answer off a real world. All right. Hey, shout out to y'all. Hey, we're doing NCLEX questions. Hey, I love y'all's participation. My name is Kevin. I go by the Boot Nurse on all social media platforms. Make sure you guys go and check that out. I'm super active on Instagram and the TikToks. I got X and I got Thread and all the other nonsense that people be having out here. You know what I'm saying? So, hey, participate. I love y'all's participation. The more y'all participate and the more that y'all are active. Hey, this is as close as I can get to being on an actual podium in front of 25 students and teaching. So I appreciate y'all. I do have a YouTube. Just check it. Everything is the Boot Nurse. You can Google it. Man, I can't even believe I said that. You could Google it and I'll pop up. Hey, the more likes that you give me, the more questions that you get. Hey, we got 25. I got 25 in the chamber right now. You know what I'm saying? But depending on how many likes y'all give me, how much y'all love me, it'll depend on how much we fire back. I'm sorry. I don't know what I did. Yeah, hey, so the more likes y'all dish out, the more questions we got, baby. Hey, 7-day NCLEX course. Of course, in case you're wondering, it's an NCLEX course I created. It's in its pre-launch phase. I failed my NCLEX 3 times. This is exactly why I do this, because I failed my NCLEX 3 times. All right, so I do these questions, and I created this course for that exact reason. Check it out. $48. Once you get it, it's yours forever. Don't troll my chat. Another thing I'm gonna put in here: don't rush me. Don't ever rush me. I'm on my time, not y'all's. Hey, if you troll my chat, you're getting to 600. That's a ban. Also, I'm not gatekeeping. I don't gatekeep. I got these questions off nurselabs.com. So if you're in your first semester in nursing school and want to know about nursing diagnosis and all the other good stuff, that's a really good website. So make sure you guys go over there and check it out. Courtney Gibson. I know a Courtney Gibson. I know one. I wonder if that's the same one. Anyways, here we go. Shout out to all 300 of y'all up in here rocking with me. Here we go. Question number 11. The nursing assistant tells you that a patient who is receiving oxygen at a flow rate of 6 liters per minute by nasal cannula is complaining of a nasal passage discomfort. What intervention should you suggest to improve the patient's comfort for this problem? Do you want to suggest the patient's oxygen, or suggest that the patient's oxygen is humidified? You want to give them a simple face mask instead of the nasal cannula? Do you want to provide an extra pillow? Because we all got to be comfy out here. Or do you want to suggest that the patient sit up in a chair at the bedside? We got A's, we got B's, we got A's and B's and some C's. But a patient should be on humidifier if on 3 or more. Okay, shout out to you, Tessie, the Bessie Tessie with the Tessie? I don't fucking know. Y'all know what's up. Between B and A. Hey, between B and A, you got to pick one. This ain't select all that apply. Can't max out nasal cannula past 4. Okay. A, I mean. Okay. All right. What else we got? What else we got? A. Your mom says A. First of all, my mom, she probably would have said A. Oh, shout out to Nurse Cass. Hey, yo, my other co-host, Nurse Cass, is up in here. Been a nurse 17 years. She works psych and she works correction, so she will fight you. I'm just saying. So shout out to Nurse Cass for being up here. Should 6 liters be via nasal cannula? That's what they gave you. That's what they gave you, right? All right, hey, I'm going to give y'all 15 more seconds. Can't max out nasal cannula past 6. You're right. Not supposed to. Maybe. Right? But don't focus on that, right? There's a lot of things. Hey, so here's the thing that you don't pay more attention. You pay more attention to the modifying phrase than the original noun, right? So the question is, so here's the original noun. Hey, I'm giving you oxygen 6 liters. Y'all are focused so much on that, but aren't focused on what is the intervention to improve the patient's comfort. All right. So here we go in 5 seconds. All right. Time's up. There we go. A, suggest that the patient's oxygen be humidified. A lot of y'all already said that. Right? Shayna said, yes, that's what I'm talking about. And you're right. Face masks are not comfortable, sir. When the oxygen flow rate is higher than 4 liters per minute, the mucous membranes can be dried out. The best treatment is to add humidification. I don't know why I just said that like I was hooked on phonics. Humidification to the oxygen delivery system. It is reasonable to use humidified oxygen for patients who require high flow oxygen systems for more than 24 hours or who report an upper airway discomfort due to dryness. Application of a water soluble jelly to the nares can also help decrease mucosal irritation. None of the other options will treat the problem. So glad I remember this from school. That's what I'm trying to say. Somebody said, will this question be considered an easy, medium, or a hard? I'm glad that you asked that question. This would be considered an easier question, right? So I'll give you so what was that question where it says, hey, we're taking care of these patients. Which patient do you see first? That stimulates your critical thinking and your clinical judgment, right? That's what we would consider an analysis question or an application question. That is a question that will be considered passing, right? So like, let me ask you this question. If they gave you a question, you have a patient who's complaining of difficulty breathing. What is the blood pressure? What is the respiratory rate that would solidify that? And then you're going to be like, whoa, I know a respiratory rate is supposed to be between 12 and 20. I know that's the normal one. What do you think? Do you think that's an easy question? That's an easy question. And now, is that a passing question? Absolutely not. Okay. So here we go. Oh, when a patient with TB is being prepared for discharge, which statement by the patient indicates the need for further teaching? All right. Now here's why I really need for y'all to RTFQ. I need for y'all to read the question. What did the patient say that warranted the nurse to educate them further? What did the patient say that was wrong that requires me to correct them? Got B. Okay. You're looking for false answers. Correct. What? So 3 of these, the patient said are correct. One of them they said was incorrect. I need to do further education on that one statement that they said that was incorrect. B all day. Who said that? Mr. Unlucky. Sir, you're going to die on that hill? You're going to die on it? You're going to die on that hill with that answer? You sure about that? Taken as prescribed. Okay. Take as prescribed. Okay, I got you. B because for a long time. Nada says, hey, look, I'm out here for it. I'm all about it. A, C, D are correct answers. Okay, so Tina, what is the incorrect answer then? Never take meds till you feel better just because the blood pressure meds, right? You take meds for 6 months at least. B, because you have to finish medications fully through the All right, 10 more seconds. All right, time's up. Here we go. The answer. Oh my God. The answer is B. I will continue to take my ionized until I am feeling completely well. Patients who take it's ionized. I always say ionized because ionized radiation had to take, must be continued for 6 months. Somebody said it exactly, for 6 months, right? The other three statements are accurate and indicate an understanding of tuberculosis. The drug of choice is ionized. It is usually given with vitamin B6. Is it a peroxidine to prevent nerve damage? It's recommended with PPD, and what else? It should be continued for 6 to 9 months. There we go. All right. Hey, shout out to y'all. Shout out to all 254 y'all for rocking that answer. Hey, even if you got that answer wrong, first of all, I love you. That's number one. Number two, if you got the answer wrong, read the rationale, see why it's correct. And then read your other answers to see why they're incorrect. You'd be so surprised to see this pop up, I don't know, 20 questions from now. All right. You can answer your own question. Okay. Here we go. Question number 13. To improve respiratory status, which medication should you be prepared to administer to a newborn infant with a respiratory distress syndrome? C. Wit. Is it wit or is it white? What? Gotta put a real emphasis on the H. Khadijah, I remember seeing you up in here. Wits up in here. Okay. What else? What else we got? B. Hi, Manasa. Hey, everybody. My other co-host is in here. Manasa Hari. Shout out to her. I don't even know how to answer this question. Hey, you better think about it. Let's paint the picture. You have a newborn who's having a respiratory issue. So not only is this like a airway breathing respiratory issue, this is also a pharmacology, right? D, not 100% though. Okay. This is why I'm a huge proponent of content, because sometimes you just can't answer the question based off of like, oh, well, I'm just going to, do process of elimination. But it's like, okay, would I use Adderall? So think about, apply what you do know, right? So what is Adderall used for? What is Adderall used for? Think about that. Okay. Right. Adderall. Oh, shout out to you, Brandon. Shout out to you being up here. So Adderall is for asthma, right? It doesn't say any, like, it's for asthma, right? And it helps with bronchodilation. But you have somebody who's has respiratory, a baby, a newborn, right? What the hell? Ariana, what does that mean? I don't know what that means. Lily said surfactant. Okay, I'm going to give you all about 10 more seconds. Surf. What are we surfing to? Oh, surfactant. I got you. All right, here we go. In 3, 2. So the answer is surfactant. Exosurf neonatal is a form of synthetic surfactant. An infant with RDS may be given 2 to 4 doses during the first 24 to 48 hours of after birth. It improves respiratory status, and research has shown a significant decrease in the incidence of pneumothorax when it is administered. Haven't learned this one yet? That's okay if you didn't learn this one, because guess what? Now it's probably going to stick in your head, right? Now it's going to stick in your head. And you got to think also, especially for those who have not gotten to pharmacology, right? This question could be part of pharmacology. It could be part of pediatrics. It could be part of fundamentals, right? So think about that. It says mom of a micro preemie and a PA. Hey, shout out to you, moms. You got a micro pre? You have your baby still a preemie? You got a big baby now? Got a big baby now? I'm going to school to be an MA, so this is all new to me. Not even sure this will apply to me. Well, by you being a medical assistant, hey, I'm telling you, Eliza, I hate farm too. But let me tell you is that as a medical assistant, this may be above you in regards to the knowledge that, because you're not going to apply the majority of this, because this is mostly for RNs and licensed practical nurses. However, it doesn't hurt to have it, because if you decide to go to nursing school, at least you'll be familiar with it. Okay, here we go. Question number 14. The clinical instructor directs the student nurse to care for a patient with a potassium of 6.7. Now, we all know that potassium is high. All right. So now paint the picture. I am using nurses' labs. I said that. Which intervention is delegated correctly to the student nurse, right? Do I want to give potassium 10 milliequivalents orally? Do I want to give K-exalate 15 milligrams orally? Do I want to give spirulolactone 25 milligrams orally? Or do I want to assess an EKG strip or ECG strip for tall T waves? Some people are saying B. Some people are saying D. All right. What are we thinking? Hey, what are we thinking? Let's stir up a conversation about this. Let's stir. How do you study fundamentals? Hey, ADPI, nursing diagnosis for fundamentals. Alexis says B. Push. You want to what? You want to what? Omen, you want to push the potassium? Oh, you want to assess the EKG strip? Oh God! Look, okay, don't do that. Don't do that, sir. Don't do that. Student nurse wouldn't be able to, wait, what? Student nurse wouldn't be able to understand EKG strip? Maybe. This is a delegation question. Yes, it is. IV, insulin, and dextrose. That's not the answer. I see where your head's at, but that ain't the answer. Hyperkalemia causes peak T waves. That's why you see a 6.7. Spirulolactone is case sparing. That, Potassium could spike T. Yep. Okay. Shout out to all 500 of y'all. Appreciate y'all. Patient care first. This is a real, is it the real life answer? Well, we're about to find out in about 15 seconds. I want to, let's see. We got B's all around. Though the patient passing high, the student will instruct to give the PO. Okay. All right, here we go. Here's your answer in 3, 2. Oh, you want the student to give K-exalate. Hey, because K-exalate means K exits late. Right? K exits late. Hey, shout out to you, Lizzie. That's what I'm talking about. All right. Delegation and supervision. The normal range for potassium is 5.3 to 5. Right? On NCLEX, they're not going to give you numbers they're not going to give you like a 3 point. They're not going to give you 3.5 or 5. They're going to give you a number like 6.7. Like, no lie. Right? They're going to give you a number like 6.7. Right? Now, the client's potassium level is high. K-exalate eliminates potassium from the body through the gastrointestinal system. The right person must be assigned to the right task and job under the right supervision. The nurse who assigns the tasks and jobs must then communicate with and direct that person doing the job and the tasks, right? So it's I thought though the range. No. So Eliza. So to answer your question, they will give you the labs. They will give you the labs on the new NCLEX. They'll give you the labs. However, me giving you the labs on NCLEX doesn't mean anything if you don't understand what a high potassium means or what a low potassium means. It doesn't matter. It does not matter. So I expect for you to know what the normal ranges of what a potassium is. But what I need for you to know is what is going to happen to your patient if they have hyperkalemia, right? But you also have to think about, hey, this is a student nurse, right? And so this is expected, right? Obviously, I'm not going to give somebody potassium because their potassium is already out of range, right? I'm not going to give spirulolactone because this is a K what? This is a K what? K wasting or K sparing? What is it? It's a K sparing. So where's my potassium going? Is it going out of my body or is it just still circulating, hanging out in my body? Right. It's K sparing, right? It's just going to hang out. It's just going to hang out, stay and be like, hey, what up, cuz? I'm trying to peak these T waves. You know what I'm saying? Like, ain't nobody, that's what it's going to do, right? So the correct answer is I need to lower that. I'm not lowering it that way. I damn sure ain't lowering it that way. And this is expected because of that. I need to get rid of that. So that's how you get rid of it. K exalate. K exits late. What does it mean, student nurse? Exactly like it sounds, Brandon. A student nurse. A nurse that is a student. This should not be a delegation question. Avery, it doesn't matter if you want it to be a delegation question, ma'am. It just for the fact that it is. And it is a delegation question because so to see a patient that has a potassium of 6.7, I mean, they could still be talking to you, but they're going to be talking about how their chest hurts and, maybe it's difficult for them breathing and yada, 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 right? I can delegate that to my patient. I mean, I could delegate that to a student because it's a PO med, right? KXLA ain't going to find K at 6. Look, I'm trying to tell you, a 6.7 is I've seen like K's like in the 9s and 10s. Don't ask me how. It's wild out here. It says insulin comes first before KXLA. Okay. So, and you're right. Insulin does come before KXLA. But where on this question do you see anything about insulin? About regular insulin? Where do you see it? You don't. So don't put, I'm sorry, y'all. I changed the question. I'm going to go back. I promise. But you don't see that in here. So don't add anything in here. If you start saying like, oh man, I would do insulin. Oh my God, insulin's not on here. So what's the answer? Don't do that. Don't do that to yourself. All right. Here we go. A patient with COPD has a nursing diagnosis of ineffective breathing patterns, which is an appropriate action to delegate to an experienced, keyword experienced, LPN under your supervision. Observe how well the patient performs pursed lip breathing. Is it B, plan a nursing care regimen that gradually increases activity and tolerance? Is it C, assist the patient with basic activities of daily living? Or is it D, consult with the physical therapy department about reconditioning exercises? Got some C's, got some A's. I was answering to friend. Oh, okay, I got you. I missed the last answer. What was the last answer? It was KXLA. Don't delegate what you can't eat. That's right. Definitely. Lizzie says definitely A. You sure about that? You sure? You sure? Man, that's like my favorite phrase. I don't know why. Favorite phrase, and I do not know why. All right, here we go. Let's see. I'll give you guys about another. Oh, you positive? Okay, cool. All right. I'm glad somebody's positive. All right, here we go. I'm gonna give y'all about 10 more seconds. Observation isn't a assessing. Observe how well the patient does pursed lip breathing. All right, here we go. In 3, 2, and the answer is A. Now I know a bunch of y'all are about to be like, "What?" Right now, experienced LPNs and LVNs can use observation of patients to gather data regarding how well patients perform interventions that they have already been taught. The scope of practice for a licensed practical or vocational nurse will most likely include the legal ability of this nurse to perform data collection, plan, implement, and evaluate care under the direct supervision and guidance of the registered nurse. Was it a student CNA? A student? I'm assuming that's what that is, right? They can observe. They cannot perform NANDA. What's the difference between observe and evaluate? So by observing, I visually see. Evaluate is like, not only do I visually see, but I come up with a plan on what I need to do next. It requires more. It requires your clinical judgment based off of your further scope of practice. Okay. All right. Shout out to y'all. Tina, I'm glad that makes sense, ma'am. I'm glad it makes sense. Shout out to y'all. Shout out all 400 plus of y'all. Make sure you guys share. Make sure you guys follow. Make sure you guys, like, share, follow. Here we go. Oh, man. Here we go. Hey, I appreciate all y'all being up here. Take a little break. For those that don't know, we're doing NCLEX questions. I got these questions off nurselabs.com. Yes, I don't gatekeep. I'm telling y'all where I got it from. I got it off nurselabs.com. All right. Hey, so we're doing NCLEX questions. My name is Kevin. I go by the Boot Nurse on all social media platforms. Make sure you guys like me. You guys follow. Make sure you guys follow. I'm trying to get unghetto. So I ain't got to do these right here. I'm trying to do here and over there. All right. So participation is the key. The more you guys participate and the more you guys answer the questions and answer each other's questions, look, we all about it. I'm all about it. Okay. Let's see. The more that you like, the more question that you get. Hey, we got 25. I got 25 in the chamber right now. You know what I'm saying? We can let off more, but it all just depends on how many likes I get. Talk about the 7-day NCLEX course. That's my NCLEX course. Check it out if you want. Links in the bios for $48. It's in its pre-launch phase. Once you have it forever. Don't troll my chat. If you troll my chat, you'll get a 600. A 600 means that I'm going to ban you. That means 600 seconds, which equals 10 minutes, and that's how long I'm going to ban you. Also, I do it on a democracy. Anybody coming here acting stupid, you guys have the choice to give someone a 600. I know, it's wonderful, right? Let me see what y'all are talking about. How often do you do these? I do these every Monday, Wednesday, Friday at 5:30. Make sure you guys go over and follow me and hit that notification button. And then also, I thought I had it where I said I went live every Monday, Wednesday, Friday, but I guess it's not over there. LPNs can help with care plans. They can help with care plans, but they cannot initiate the care plans. Do you need a water break? First of all, no. All right, on to the next one. I'm ready to learn. Is that Jayla? Jayla, you ready to learn? Look, okay? We out here learning. A bunch of learning doctors. All right, here we go. Or learning nurses. Some people are doctors up in here, you know. Nurse educator, that's what I'm talking about. Hey, that's what I'm going to school for. So, hey, shout out to you. The Davy Jones experience. Is that what that's going for? Okay, cool. All right, here we go. Question number 16. When assessing a 22-year-old patient who required emergency surgery and multiple transfusions 3 days ago, you find the patient looks anxious and has labored respirations at a rate of 38 breaths per minute. The O2 saturation is 90%, with oxygen being delivered 6 liters per minute via nasal cannula. Which action is most appropriate? So remember, there's a big difference between most and first. Right? So first, I want to do it on a systematic approach. I wanted it to be systematic. 1, 2, 3, and 4. What is the very first thing that I'm going to do? Right? So do you put your pants on before you put your shoes on? Or do you put your shoes on and your pants? It's stuff, stuff like that. You know what I'm saying? Versus most. If I could do one thing and leave, what would it be? One thing and leave. Give them the highest non-rebreather. So it's D. Okay, Lizzie, you ain't got to yell at me. Lord of mercy. 38 respirator, probably an adequate time. D. Shout out, thanks Chris for the follow. Appreciate you. Tiffany says also pay attention to steps in the nursing process. And if all else fails, always go back to the nursing process. Sarah says I think it's D. Sarah, I'm gonna need for you to definitively tell me that is D. Call RT, ma'am. That ain't on there. Somebody was just like, just call Jesus. First of all, that's not something we should say in the hospital at all. I'm just saying. Tyler says too easy. If looking to assess, don't do interventions. Hey, so that's another thing is like, do you assess before you implement? And by implement, meaning, you jump right into it, or do you jump right into it before you have to assess? Right? So what's the difference between first and most? I just said that. All right, here, I'm gonna give you guys about another 15 seconds. I dislike those problems. What do you mean, Natalie? What do you mean you dislike them? I dislike a lot of things, like taxes, but I got to pay them. Hey, anybody ever seen the House Bunny? All I want to say is Natalie. All right, here we go. 3, 2, 1. All right, hey, so the answer is switch the patient to a non-rebreather mask at 95% to 100% oxygen and call the physician to discuss the patient's status. The patient's history and symptoms suggest the development of ARDS, right? Which will require intubation and mechanical ventilation. Patients are mechanically ventilated, guarded against the fluid overload with diuretics, and given nutritional support until evidence of improvement is observed. I'm not even a nurse and I knew that. Okay, Teresa, you knew that. Good for you. I'm just playing. I'm glad that you knew that. Hey, because the more that you know. Anybody know the difference between first and the most important? So I just said that. I don't know how to say your name. Your last name is Sanchez. I'm just going to say Sanchez. I officially survived. That Mallory? Mallory. Okay. 3 weeks of nursing school. Shout out to you, ma'am. Shout out to you. So to answer your question, is it Miss Sanchez? The difference between first and most. With first, it's on a systematic approach, right? So it's 1 through 4. What is the very first thing that you're going to do, right? Or who is the very first patient that you're going to see? Now, when it comes to most, right? When it comes to the most, I need to know if there's only one thing that I could do to save my patient or stabilize my patient and then leave, what would it be? That's the difference between answering a first question versus answering a best or a most question. Does that make sense? Does that make sense? All right, here we go. Sometimes all the answers are correct, but you have to pay attention to the first, immediately, and most. Exactly, Lizzie. Yep. Oh, that makes sense. One thing, they then leave the room. Exactly. If I could do one thing and then leave, I'm sorry, I don't know why I did that. If I could do one thing and leave, what would it be? That's what most would mean. Okay, here we go. Question number 17. Which of these medication orders for a patient with a pulmonary embolism is more important to clarify to the prescribing physician before administrating, right? So what is so important that I need to tell the physician before I give it, right? Got D's and got B's. We got warfarin or Coumadin, 1.0 milligrams by mouth PO. Is it morphine sulfate 2 to 4 milligrams IV? Is it a cephalexin or Keflex at 250 milligrams PO? Or is it heparin infusion at 900 units per hour? So we aren't that far into pharmacology yet. Bella, look. I'm a need for you. You just passed your NCLEX. Who said that? Is that Heart with a doggy face? Congratulations to you, everybody. Hey, everybody give Heart doggy face some love for passing that NCLEX. 900 units. Wow, look. I've seen it to where it's like 50,000 units. That's sounding like CRT. You know what I'm saying? And 50,000 units of heparin, or not 50,000, no, 25,000 and 50 or 5,000 units of heparin on different things. So it all just depends. Congratulations to Hardy Doggy Face for being for passing NCLEX. What type of nurse are you? Are you an RN or an LPN? And also, welcome to the shit show. Well, I mean, welcome to this greatness that we call being nursing. I failed mine 2 weeks ago. And I'm so depressed. Alfredo, I'm going to ask you, okay, so you failed it. Cool. So what are you going to do about it? That's another thing. Don't come into my chat telling that you failed something and you don't fix it, right? So you got to figure out what the issue is. I passed my NCLEX and I still didn't know this one. That's okay. Hey, the NCLEX is all about what you like, what does everybody know, right? All right. So we're kind of all over the place. Cath Lab RN. What's the answer then? Cath Lab RN Justin Wyatt 77, sir? Oh my God. Here we go. All right. I passed the NCLEX PN next year and I'm terrified. Don't be terrified of it. Hey, if you're scared, go to church. No trailing zeros. You're better than that. That's right. All right. Here we go. Here's our answer. And the answer is warfarin, right? 1.0 milligrams by mouth, PO, right? So medication safety. This is a fundamentals and a pharmacology type of question, guys. Okay, this is something that you learn in fundamentals. Yeah, I said we're getting ready for dosage calculations. Look, ma'am, you better get ready for it. Yeah, the trickery, Ashley. I know it's absurd. I'm trying to tell you, it's crazy out here. Sorry, guys. Can you guys still hear me? Because I know my mic be acting kind of funky out here. All right, here we go. Sorry, guys. Let me get that taken care of. So medication safety guidelines indicate the use of trailing zeros is not appropriate when writing medication orders because the order can easily be mistaken for a larger dose, such as 10 milligrams. The order should be clarified before administration. The other orders are appropriate based on the patient's diagnosis. Look, let me tell you something. I read an order wrong one time, and I almost gave somebody 20 units of Lispro. The question is misleading. Is it though? Is the question misleading, Brit Love 94, or did you misread it? Did you not read the fucking question? Did you not RTFQ? See what I'm saying? Can't believe people said heparin, the rate wasn't outrageous. We got to think. Howard, you can't say that because some people are in a different different area of their knowledge than you are. RTFQ, right? Can you clarify the trailing zero? So just like I said, is like you don't want to have a trailing zero because it could be mistaken for a larger dose, such as 10 milligrams, right? And trust me, it can make a world of difference. Can you push the computer back a little bit? Just asking. Let's see. I'm trying my best here. This is what happens. The answer is A. It's warfarin because it has a trailing zero. What's up, Sandy? I am better, actually. I mean, I'm still hurting, but I'm better than I was last week. There you go. That's what I'm saying. You gotta read the question. So the most important thing is now this is a safety issue. NCLEX is all about nurse safety, right? It is all about nurse safety. Let me tell you something. Your boy almost gave somebody 20 units of Lispro when I was a nursing student. And let me tell you, when not only did my preceptor, she was very nice about it, which she should not have been, in my opinion. But she humbled me very quickly. I don't make medication errors. Like I check that list. I look at that list and I check it twice on some Santa Claus ish. You know what I'm saying? So I'm just letting y'all know. All right, here we go. Question number 18. You are a team leader RN working with a student nurse. The student nurse is to teach a patient how to use an MDI without a spacer. Put in the correct order the steps that the student nurse should teach the patient. Oh, that's called a near miss event. Yes, ma'am, it is called a near miss event. And I definitely had to fill one out. And she definitely made me fill one out. All the above, ma'am, Lizzie, this again? We're really doing this again? I can't see the last two. How can y'all not see the last two? I don't even know what's going on here. Let's see. I don't know why. There we go. Is that better? Let me know if that's better. Rika? Is it Rika? It is hard. It's hard. Yeah, You playing? Playing games with me? Fix your screen. Hey, how about you ask? How about you ask that I fix the screen? I'm a little feisty. Look, don't be coming up in here acting a fool. You know what I'm saying? Because, hey, I will. I don't know what this is. Oh, all right. Hey, is that better? Hey, this is what I'm trying to tell y'all. Because auto translate is on? What you mean? I don't even know what that means. All right, here we go. Not the fingers. Look, hey, Sandy, you better let them know. They'll get the fingers. They'll get all that. All right, I'm going to give y'all 15 more seconds. The dictating wordings covering the second option. Damn, that must be really high. I don't even know what the hell's going on. Hold on one second. Let me bring it up some. Is that better? Do I need to bring it up some? Or is it me? That's much better. Thank you, sir. Okay. All right, here we go. We've been on this question for a while. I think I can't see because the caption is whatever. Perfect. Okay. Can I screenshot? I mean, sure. You can screenshot, but like I said, I get these questions off of nurselabs.com. You can go and find you the quiz over there. That's better. Okay. Here we go. So the answer is CAEFDB. I don't know why I said it like that. I feel like I would teach my son that. CAEFDB. I'm not going to read all these. How do I feel about Archer? I think Archer's great. Hey, look, just because I got my own review out here and I'm out here trying to eat, I ain't gonna shit on no other review. If there's other reviews out there that are terrible, I just won't mention them. I read it backwards, threw me away. I'll throw you away. Look, I mean, like swish. No, I'm just playing. What about UWorld? I didn't like UWorld. For me personally, I'm assuming your name is Brittany, so I'm just gonna call you Brittany. I didn't like UWorld, me personally. But UWorld, for what I know now, is I think they have content videos to go along with their questions. The only thing about UWorld is that UWorld's been around for a long time, just like Kaplan, so they're a little bit more on the expensive side. So I think it's like $300 or like $200 for like 90 days or 60 days or something along the lines of that. So I do like Archer. Yep. Did you use, what did you use to pass? I used Kaplan and I used Mark Klemick. Danny, I actually made a whole review. So are you doing the 3-day live prep, Danny? Are you doing the 3-day live one? ATI, I don't like ATI at all. Just like I don't like HESI. I don't like ATI or HESI at all, period. Danny, if you're doing the live prep, I never did the live prep. I have Kaplan, but I don't like it. So here's the thing. To each their own. Like, not all reviews are gonna be up your not all reviews are gonna be up your alley. I'm trying to tell you that right now. Who said that? Caitlin said, can we use this as a break? Caitlin, we're almost to a break actually. Danny, I take that back. I did the 3-day Kaplan live review and I didn't like it because all it was I just didn't like it. I used Kaplan, but I also went with Rachel Allen course. I heard Rachel Allen's pretty good. I've never used her, honestly. So, all right, here we go. Question number 19. You are acting as a preceptor for a newly graduated RN during her or his second week of orientation. You would assign the new RN under your supervision to provide care to which patient? Select all that apply. There's only 4, guys. There's only 4. A 38-year-old with moderate persistent asthma waiting discharge. A 63-year-old with a tracheostomy. What the heck? With a tracheostomy needing tracheostomy care every shift. A 56-year-old with lung cancer who has just undergone a left lower lobectomy, or a 49-year-old just admitted with a new diagnosis of esophageal cancer. A and B. Liz, are you sure? Are you sure? You sure about that? I'm going to give you guys about 30 seconds to answer. It says real life answer is all the above, so new grads get more. Okay, so the real life answer, we're not doing real life answers, Howard. We ain't doing that. Howard, we ain't doing all that. So yes, the real life answer is for a new grad, it all just depends. Like how the preceptors are and how they want to do all that other stuff. But in reality, we're not doing new grads. We're not doing all that. Stable versus unstable, right? Okay. All right, I'm going to give you guys about another 15 seconds. Real life, they be caring for all of them. Yep, they do. Kim Parker. Miss Parker, thank you for the follow. Appreciate you. All right, here we go. Here's the answer, y'all. Hey, shout out to all. There was like 700 people in here, but shout out to y'all. So the answer is A and B. So the answer is A and B. A patient who is awaiting discharge may be stable enough for the care of the student nurse. The client is the center of care. The needs of the client must be competently met with the knowledge, skills, and ability of the staff to meet these needs. And for B, the new RN is at an early point in their orientation. The most appropriate patients to assign to her are those in stable conditions who require routine care. Just like that. Tricked me, asked me, and I said, look, I just asked questions. It ain't my fault that you changed it. Stick to your answer. Don't change them on the exam. That's facts. This one was difficult, right? So you got to think. You also, like I said, when I tell you guys to paint a picture, I want you guys to put yourselves, especially my new nurses and my new nursing students. It's just like, what type of patient would you want to take as a new nurse? Like, would you want to take a patient who just came in, when you don't necessarily know everything? Would you like to take care of a patient who just came back from getting their lung taken out? Right. I mean, it'd be great, but you're not gonna, because that's an unstable patient coming from the operating room. Right. So think about it. Just think about that. Think about that. All right, here we go. Question number 20. Jenna is a nurse from the med-surg unit of a tertiary hospital. She was asked to float to an orthopedic ward in which she has no prior experience working on. Which client should be assigned to her? All right. So she has no experience on this floor. She's going to be treated like any new person that has the basic skills that a nurse is supposed to have. Right. Alejandra said, I want a nurse who knows what they're doing, period. Well, Alejandra, I'm sorry. Not every nurse, your experience may differ, because not every nurse is going to know everything. And that's facts. Shout out to all 350, how many? 380 y'all? We got D. Okay. I was going to read them, but y'all already beat me to it. So make sure you guys share. Make sure you guys like. Make sure you guys follow, because I love y'all. Appreciate you. Cat's Karma, appreciate the follow. User 45, appreciate the follow. Destiny, thank you for the follow. All right, I'm going to give you guys about another 15 seconds. Oh, and I got a rose. Karma. Thank you, girl. Appreciate you. Kiki says B. Okay. Tori says D. Lily says D. User. Oh, hey, shout out to y'all. Appreciate you. No aid. Look, let me tell you something. I've worked a long time and look, we ain't even going there. All right, here we go. The answer is D. A nurse from the med-surg unit floated to the orthopedic unit should be giving clients with a stable condition as those who have care similar to her training and experience. A client who is in a post-operative state is more likely to be in a stable condition, right? So what other person... So, okay, we have this nurse, Jenna, going to a new unit with no experience. Who else could I give these patients to? Who else could I give that patient to? As the RN, who else could I delegate that patient to? Since they're stable, there you go, the LPN, right? So think about that. And as the LPN, you got to think to yourself, what assignment can I take? What assignment can I take? Right? Oh, all right. So hey, who said it? Was it Caitlin? Ma'am, this is your break. So if you got to go pee, if you got to go do something, or if you got to take your phone with you, because, that's just how technology works. I'm just saying, you guys ain't in Texas. Julie, I don't know what that means, because I am in Texas. I live here, madam. You see what I'm saying? Melissa, oh my God. 15 roses? Man, I feel like that one dude, at a bar, and I'm outside with the smokers, and the lady out there asking me how much I want to buy a flower for. And I don't want to buy any, but I appreciate the love. I appreciate you. All right, here we go. Hey, we're doing NCLEX questions. Laney, I appreciate you. I don't know what the yes is for, but I appreciate you. Hey, we're doing NCLEX questions. Hey, so make sure you guys participate. My name is Kevin. I go by the Boot Nurse on all social media platforms. Check me out on YouTube. If you miss this live, or if you know anybody that misses it, go check it out on YouTube. I post all of them there. There's 3 that are going up right now. What part of Texas, Laney? Participate. Participation is the key. I'm kind of, sort of, but not really, but maybe kind of, maybe funny. Just make me laugh. Make me laugh, okay? It costs nothing to be nice, all right? The more you like, the more questions that you get. Hey, we're coming up on 25 questions, so the more likes that I get, the more questions that you get. I'm just saying, you dish them out, that's what you get, you know what I'm saying? I created a course, 7-day NCLEX course. If you guys don't know my story, you guys can go check it out on YouTube, but I failed my NCLEX 3 times, y'all. Three, and then I passed on the 4th. So I understand what it's like to be in this position. I understand what it's like to be a nursing student and be scared. And then I went to church for that. I understand what all that's like. All right. But the only way that you can get through it is that you got to push. You got to put your head down into the sand and you got to push your way through it. Nursing school is not easy, and it's not meant to be easy, because if it was, every other motherfucker would be doing it with us. Trust and believe me. All right. So check out the 7-day NCLEX course. That link is in my bio. Don't troll my chat. Everybody's been pretty cool. If you get a 600, that means you're getting banned. I don't gatekeep, because I got these questions, again, I got them from nurseslabs.com. So anybody that's in school right now, you need help with your nursing diagnosis, all that stuff is over there. And you can get you some sample questions and all that good jazz. All right. So without further ado, let us jump to the next batch of questions. Here we go. Question 24. Which intervention for a patient with a pulmonary embolus could be delegated to the LPN on the care team? Is it A, evaluating the patient's complaint of chest pain? Is it B, monitoring lab values for changes in oxygenation? Is it C, assessing for symptoms of respiratory failure? Or is it D, auscultating lungs for crackles? B, I thought it was easy. What you mean? What do you mean? Killer Balla 24 or 2004? You thought what was easy? And once again, if you're talking about school or the NCLEX, once again, your experience may differ. You never know what anybody got going on. There was a lady in here who told me her mom died during school. And I'm telling you right now, I don't even know how. Don't even know how she even remained focused after that. So, true. Best of luck to all. Appreciate you. I wouldn't even make it through school if that happened. I'm just letting y'all know. I'm just telling y'all right now. Y'all, hey, you never know what a motherfucker going through. You never know what they're going through. I'm going to give y'all about another 30 seconds. Probably less than that. Lily says D. Cooper says D. Alexis says B. Yeb says D. Thanks. Is that Alexandria? Appreciate the follow. Miss Parker says D. Claudia says B. D. I don't think B is an intervention. Okay. Yeb. Thank you for the follow. Oh, all right. Here we go. Answering in 5, 3. All right, we're done. So the answer is D. We're going to auscultate them lung sounds for crackles. We're going to auscultate them. I know you're going to be like, what? Damn. Hey, Haley, it's okay, though. It's all right. Let us read the rationale, though. Let's read the rationale. An LPN who has been trained to auscultate lung sounds can gather data for routine assessments and observation under the supervision of the RN. Right? The scope of practice for the licensed practical or vocational nurse will most likely include the legal ability of this nurse to perform data collection, plan, implement, and evaluate care under the direct supervision and guidance of a registered nurse. Somebody said an LPN can't look at labs. It didn't say that you couldn't look at labs. It says you're monitoring the lab values for changes in oxygenation. But let's see. Let us see, Avery, why the answer is right, or why B is incorrect. Part of supervision entails the ongoing evaluation of staff's ability by the registered nurse to perform assigned tasks using direct observation and with indirect observation of patient safety, the quality of the care provided and the appropriateness of patient care or the care provided, and the timelessness or the timeliness of care provided. I don't even like that rationale, like at all. And A, what was A? Let's see. A says evaluate the patient's complaint. So you got to think, it's just like, as the LPN, there are certain things that you can evaluate based off of, like, if I have a patient and they're stable. If I have a patient, they're stable. And then me as the LPN, if I go and I do an assessment, because an LPN can do an assessment, right? They can do an assessment based off of their level, because my assessment, I'm going to check crackles, I'm going to check vital signs, blah, 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 blah. If they're out of range, the first person that I'm telling is the RN. So you have to auscultate. So no one said anything about you evaluating, because you don't evaluate. However, you auscultating the lung sounds is you collecting data to provide to the registered nurse, for the registered nurse to create a care plan. And it's all about interpretation, correct? The RN is to interpret based off of the data that is being collected. Remember, it is you can evaluate under the direct supervision of the RN. So I'm going to go and I'm going to be like, as the LPN, I'm going to check lung sounds. Oh, I hear crackles. I'm thinking that they're having a fluid issue, or that, they have a pulmonary embolism. Hey, I need to go tell the nurse, hey, I'm hearing crackles. Oh, okay. So now that prompts this nurse, the RN, to go and do a further assessment of this patient. It says B requires critical thinking. D is a skill that is being supervised. Correct. Is it a turquoise, aqua, blue? First of all, those are all blues. Like, those are all the same type of color. Can you show the answers again, please? This is the answer we're talking about. Oh, the answer choices. There we go. Sorry. Here we go. It says the patient perception of pain, but it says the what? Caitlin, what do you mean? Elaborate for me. All right, we're going to go on to the next question while you answer that for me. All right, here we go. I appreciate all the follows. Hey, here we go. Question number 22. The nurse plans to care for a client in the post-anesthesia care unit, or the PACU, as we call it. Which of the following should the nurse assess first? What is the very first thing that I need to do? What is it? Think about it. Let's paint a picture. You got a patient who is in the PACU, which means that they just came from the operating room, or they came from somewhere where they got some type of procedure, right? What is the very first thing that I want to do? Is it respiratory status, level of consciousness, level of pain, reflexes, and movement of extremities? It says the patient's, hold on. I'm going back, Caitlin, to see what you said. It says the patient's complaint of pain, not a true assessment. Correct. Because if I'm as the LPN, I'm going to be like, hey, he's complaining of chest pain. Oh, okay. Now I need to go intervene as the RN. ABCs. ABC. It's easy as one. It's not though. You know what I'm saying? So, all right. I think everybody has their answers. Somebody said B up in here. No. I think A. Okay. ABCs. All right. Is that Antoinetta? Well, the answer is A. The answer is A. Assessing respiratory status is the very first priority. Most people that are coming into the PACU are under general anesthesia. Remember ABCs, like you guys said. General anesthesia and mechanical ventilation impair pulmonary function, even in normal individuals, and result in decreased oxygenation in the post-anesthesia period. They also cause a reduction in functional residual capacity of up to 50% of the pre-anesthesia value. Maslow's law. Physical, psychosocial. This is physical, right? But airway, breathing, circulation. You got to think, it's like if you're under general anesthesia, you're getting intubated. One of the biggest things that I'm thinking about are upper airway type of obstruction. So if your patient starts to have a laryngeal spasm, or if they're stridorous, they're having an upper airway issue. The first time you hear somebody go, you're going to fucking just, everyone's eyes are going to get big, and you're going to look the direction from where that, I don't know what the hell that sounds like one of the Demogorgons from fucking Stranger Things. That's what it sounds like. Whoever that patient is, I'm just saying. All right. So, Strider, oh my God, get an adult. Look, I'm trying to tell you. Hey, who is that? Tiara? You're welcome, ma'am. You're welcome. So I'm trying to tell you, the first time you hear Strider, or the first time you ever see someone throw a pulmonary embolism, let me tell you something right now. That's going to be, I'm trying to tell you right now. I saw a lot of, I worked during COVID, and I'm trying to tell you right now, that shit ain't no joke. Here we go. Question number 23. Nurse Jackie, Hey, ain't that a Netflix show? Nurse Jackie is reviewing the diet of a 28-year-old female who reports several months of intermittent abdominal pain, abdominal bloating, and flatulence. The nurse should tell the client to avoid what? Is it fiber, broccoli, yogurt, or simple carbohydrates? Broccoli gives you the farts? Ma'am, it does not give me the farts. Oh, you're saying in general. Oh, okay, I'm tracking. I got you, Avery. Oh, Tanisha says broccoli. Somebody says simple carbohydrates. Sage. Is it sin strawberry mushroom? It says C. Okay. Young Haro. Kelsey says C. Lily says D. Appreciate the follow. Brock. Lactose intolerance. Oh, you don't know. Okay, you're saying C, I'm assuming, because of the yogurts. All right, let me give you all about 10 more seconds. Broccoli. I forgot about the broccoli emoji. But who's that? Turquoise, aqua blue, Miss Blue all over the place. Appreciate the follow. Thank you. Here we go. Here is your answer. Broccoli. The answer is broccoli. No matter what you say right now, the answer is broccoli. Okay. Broccoli is known to be gas forming, which can lead to bloating and therefore should be avoided. In general, gassy foods are those that contain certain sugars. Is it fructose, lactose, ribose, sorbitol, and or soluble fibers. These substances are not digested at the level of the stomach and thus make their way down to the intestines where bacteria breaks them down. The end result of this breakdown is the release of gas. Oh my God, not broccoli. Look, I'm just saying. If you having stomach problems and you're bloated and your abdomen's be hurting, maybe you shouldn't do the broccoli. It's not even a real vegetable. What does that even mean, Vega? What do you mean it grows? It grows somewhere. Oh, who's that user one time? Broccoli is delicious. I'm just saying. Hey, what about Brussels sprouts? How you feel about Brussels sprouts? I'm just saying. It's a hybrid. Hey, it's still delicious though. It's GMO, still delicious, and I bet y'all gonna eat it. Anyways, here we go. I read broccoli was full of protein. I don't even know. Now I think about it. But broccoli is delicious. Brussels sprouts. Hey, look. Hey, here's a little trick for y'all. Go get y'all some Brussels sprouts, right? Cut them in half. Drizzle like some oil on them or whatever. Then get like some Himalayan bougie sea salt. Put it in the oven for like 10 minutes. Best snack I ever had. I'm just letting you know. Here we go. Question number 24. Nurse Manasa. No, she did not. That is hilarious. Oh, I love that. Nurse Manasa of the Boot Nurse Medical Center is planning care for a client who underwent a colposcopy. Colposcopy. That's a real thing. I always get tongue twisted, right? Which of the following action should the RN take first? So what is the very first thing I should do? What's the very first thing I should do? Avery, you are correct. We have done these before, but notice how a lot of people haven't seen these, right? Is it A, discuss the client's fear regarding potential cervical cancer? Is it assist with silver nitrate application to the cervix to control bleeding? Is it C, give instructions regarding douching and sexual relations? Or is it D, administer pain medications? Sandy says B. We got A's, freedom. No lie, I thought you said freedom equals EBT, and I'm just like, first of all, I don't even know if that's true. But the way that food prices are going up, I could really use some EBT out here. I'm just saying. Tanisha says A. Okay. Is that Zoe Williams? All right. What we got? What else we got? Got A. Freedom says B. Is that Chastity? Follow. Hey, I appreciate you, Chastity. Thanks for the follow. All right, I'm going to give you guys about 15 seconds. 15. A, it says planning care. What? Oh, okay. I'm tracking. What is the very first thing that we should do? So remember, you have a patient who just got finished with a procedure. They undergone a procedure, right? So what is the very first thing I should do? The very first thing. Think about it. And remember, this is where we learn a ton, because if you don't know what this is, you're about to find out. All right, here goes the answer. Ready? In 3, 2. The answer is B. Is that I want to assist with silver nitrate application to the cervix to control bleeding. A colposcopy is a procedure to examine the cervix, vagina, and vulva for signs of disease. The priority nursing action when caring for a client who has undergone a colposcopy is to assist in controlling potential bleeding by applying silver nitrate to the cervix. Typically, not painfully. Look, I don't know. I don't write the rules. I don't have those parts. I don't know how it feels. Yeah, so there's that. Right. Homeostasis is the priority over pain. Correct. Stop that bleeding, because guess what? They ain't got no bleeding in their body. They ain't going to feel no pain. You know what I'm saying? They're going to go up, then people are going to be asking me about ROSC. If y'all don't know what ROSC is, I'm going to need for y'all to. Oh my God. The trick is undergone. It is. What is silver nitrate application? So silver nitrate application, it's silver nitrate like on a Q-tip, sort of speaking. It helps with what is the proper word for me to say? It helps with like cauterization. It helps with like cauterization. It stops bleeding. There you go. There you go. It says ROSC is when people come back from the dead. Yes, Howard. Yes, it is. I actually had I didn't have one. One of my friends had one of those. It was a picture of Jesus and it said, "Ask me about ROSC." Not even gonna lie to you. Darkest humor and probably one of the funniest things I think I've ever seen in my entire life. Oh my goodness. All right, here we go. Question number 25. Shout out to all 300 y'all rocking with me. Hey, we're doing NCLEX questions. Make sure you guys let me know who you are, where you're from, where you're at in your nursing journey. Yeah. So let's get it on and popping. Let's see what we got. Sally is a nurse working in the emergency department and receives a client after a radiological accident. Paint the picture. A radiological accident, right? So this is probably like some type of bioterrorism thing that's happened outside, like whatever, right? Which task is the utmost priority for the nurse to do first? Is it decontaminate the client's clothing? Is it decontaminate the open wound on the patient's thigh? Decontaminate the examination room the client is placed in? Or save the client's vomitus for analysis by the radiation safety staff? We got B. What is N? I don't know what N is. What is that? What it is? 4 years in med surg and a level 1 trauma center hospital. Shout out to you. Is it Danielle? Danielle Lacey? Arkansas? Sorry, wrong button. Oh, okay. All right, I got you. Detroit just graduated BSN. Shout out to you. Is it Ashry? Oh my God. Where is the L in that name? What are we doing? What are we thinking, y'all? What are we thinking? Hey, says B. I'm not even going to say your name, but your last name is Cheesy, and this is B. What unit do you specifically work on? Right now, I work in the operating room, but I've worked in the ICU and I've worked in PACU. Got B. Thoughts on the PCU? I mean, I think it's cool. I can't see the entire question. Lauren, I'm sorry. I don't even know how to help you with that, to be honest, because I've literally tried to move this and most people can see it. Most people can't. So, okay, tell us the answer. No, I'm not telling you the answer. I'll tell you the answer when I'm ready. How about that? Hey. All right, here we go. Oh my God. You're welcome, Lauren. Massage the fundus. What? Huh? What does that even mean? Here we go. The answer is B. Like most of you guys put up in here, right? Decontaminate the open wound on the client's thigh. Decontaminating an open wound is the very first priority for the client. This minimizes the absorption of the radiation in the client's body. A radiological accident is an event that involves the release of potential dangerous radioactive material into the environment. So think of like Chernobyl, or think of like Fukushima, like that happened in Japan. Think of, all those nuclear power plants, stuff like that. This release is usually in the form of a cloud or plume. So like nuclear explosions or whatever, and can affect the health and safety of everyone in its path. So think of that. Did the question say there was an open wound? It didn't. It said the answer did though. right? It says, what is the utmost priority? So what is the utmost priority for the nurse to do first? So you have utmost priority, meaning what is the very first thing I should do, to the very first thing I should do. Rinse the eyes. That ain't even on here. What are you talking about? Oh my God. It's not what's right. It's what, yeah, is that Kareem? So it's not, yeah, it's not what's right. It's what's most right. Correct. You are correct. I feel I know nothing. To be fair, I know nothing either. I'm right there with you. I know nothing, but you want to know why we do these is so you can know something. All right. We do these so you can know something. Hey, and that's it, y'all. That's all I got. That's all I got. That's all I got for today for y'all. So I appreciate everybody. You're welcome. I'm going to sit on here so y'all could, I guess, see my hideous face. Hey, Jaden, I appreciate the follow. What up? Hey, how y'all doing? I'm late. Look, if you're late, you might want to go to like Walmart, get a pregnancy test. I don't know what you need to do, but, oh, I'm sorry. I don't mean that. So I do these quizzes every Monday, Wednesday, and Friday at 5:30. I'm taking the NCLEX in 3 weeks. Any advice? You need to recreate the testing center. That's the very first thing that you need to do. You need to recreate the testing center. You need to put yourself on a study schedule. You need to create a study plan. So essentially, like, where do you have the hardest time, like, learning? For me, it was pharmacology. It's a monster. Pharmacology is a beast of a category. It's the second largest on the entire NCLEX exam on RN and LPN. Okay, so I would say do that. Take accountability for what you do and what you don't do. Cut everybody off. Your nursing license and your degree is going to say your name and your name only. It ain't going to say, people, let me tell you about my best friend. That motherfucker ain't on there. Laying out of that right now. Okay, so do those things, right? And then also think about what type of learner that you are. Like, how do you absorb material? Like, how do you retain it? Is it audio book? Is it like how I was doing on here with the Q&A? Do you need a coach? Do you need a mentor? Like, do you read? You can't put a book in front of me because let me tell you, the fastest way for Kevin to fall asleep is to put a book in front of me. But audio book, is it YouTube? Like, you got to think about those things. You know what I mean? Audio visual. Are you a read write? Kinesthetic. The majority of us are kinesthetic, right? So actually learn the whys of everything instead of memorizing. Exactly. Right. I fully expect. Here's the thing that NCLEX expects. Right. And this is coming from somebody who's a veteran, not just in the military, but a veteran of taking the NCLEX. They know that you know what the normal stuff is. But I need to know that you know what to do when it's outside of a normal range. Either it be too high or it be too low. Oh, I like you already. What you talking about? Thank you for your advice. You're welcome. You're welcome. So you really got to think about that. You have a 7-day boot camp. Ashley, it's called the 7-day NCLEX course. The whole premise of it is because I've been through those 3-day courses and I feel like they jam pack so much stuff into them. So what I did is I was like, you know what? Let's spread it out a little bit over a week, right? Give yourself 2 to 3 hours every day and, sit down and we'll go through questions together. Now, right now, it's in its pre-launch phase and it's going to be on demand. So essentially how I just did it is how my program is laid out. All right. But those aren't in there yet. And that's the reason why it's $48, baby. Like, especially for everybody that's new. Like, if you're a new nursing student and you just started school, and for you to, hey, I really think it's a huge flex if you go over there and be like, hey, yo, I got an NCLEX review for like $48, bitch. Like, you know what I'm saying? So I'm just saying. So I like the way you present the questions. I appreciate that. You want to know why? Is because when it comes to hard questions, you have to break them down as if you're talking to a 5th grader. You really do. Like, you really have to break it down as if you're talking to a 5th grader, because even though we have to know the jargon and we have to know the language, you have to be able to comprehend it. Right. Genetics says otherwise. Personally, I could care less. Live your best life. I don't even know what you're talking about. I don't even know what you're talking about. I memorized to get through nursing school. I didn't learn by reading. It's questions for me. You rock. I appreciate it. But like I said, it all just depends. I mean, and then some people have other like learning disabilities. Like, a lot of people have anxiety or ADHD and stuff like that. If you have like problems like focusing and anxiety, you might want to go get some additional help with that, because, where you can actually have focus. It happens. Don't be ashamed of it. Don't be ashamed of it either. Don't be ashamed about the fact that you got to go talk to somebody about getting on something, so you can help you. Because that test anxiety is real, y'all. Like, legit. It ain't a joke. It ain't a joke. But hey, I appreciate y'all rocking with me. We got 238 people up in here. Hey, what questions y'all got? Join the team. Is it Nixon? Okay. What questions y'all got? Let me know who you are, where you're from. I know we were just doing questions a whole second ago, so y'all let me know. I would put on some music, but last time I got copyright strike, and then they got mad at me, so I can't do that no more. I'm just saying. What question y'all got? You from Florida? I lived in Florida for a little bit. Pros and cons of working in the OR. The pros, you get one patient at a time. There's at least 4 people that are going to be around the patient when the patient undergoes the procedure. Biggest thing is one patient at a time. Like, I'm going to lie to you. However, the cons are, depending on the hospital, will depend on the level of responsibility that you're going to do. The second thing is, being an OR nurse, you lose a lot of the basic skills that you've had that you would get if you went to like med surg or if you went to ICU or anything like that. I live in Minnesota. I live in Texas, the only state that matters. Yeah, I said it. How can I reach you to explain my personal situation? So you can either reach me on TikTok, you can either reach me on Instagram, all that stuff like that. Aside from Nurse Labs, do you recommend any other resources? It depends on where you are in your nursing journey, Tiara. So like if you're a nursing student, there's tons I could recommend. If you're about to graduate and need an NCLEX review, I got a ton that I could think of. YouTube channels, all that stuff. What's your background? What do you mean, Freedom? Like, what do you mean, like what context? Nixon said, what are you doing? Okay, cool. We'll reach out. Thanks. No problem. NCLEX reviews. So there's tons of NCLEX reviews out there. First of all, I have no shame in talking about mine because I know what I put behind my stuff. So mine, check it out. That's number 1. Number 2, you got Archer, you got UWorld, you got Picmonic, you got Simple Nursing, you got Remar, Mark Klimic, you got Kaplan, you got Hearst. I've used Hearst, I've used Kaplan, I've used Mark Klimic, I didn't use Archer, I didn't use Picmonic, and I used, what was the other one? UWorld. I love Kaplan. I liked Kaplan so much is that I even made a review. So you can check that out. That's on my TikTok, that's on my IG, that's on my YouTube as well. Hello, you have School of Nursing Online. So I have it's an online on-demand like program to where you can do it by yourself. Zach said, where did you do your RN? Were you still active duty HM? I was an active duty hospital corpsman. As a matter of fact, on the 27th, it'll be 16 years that I've been in the Navy. So I'm in the Navy Reserves right now. But yes, I was an active duty hospital corpsman. I was also a surgical tech instructor while I was getting my RN, and it was out here in Texas. So yeah, I got my whole RN stuff while I was active duty. You did a very good review just now. Oh, thanks. Thank you, Miss Parker. I don't know why I keep saying that. I was watching Friday not too long ago. So I only use Kaplan. I didn't know all these other resources. Hey, the more you know. Hey, here's the thing. You don't know what you don't know. But then again, it's just like you don't want to use anybody else's review or anybody else's product unless you see like social proof, like usually like somebody that you know, like, oh, I used it and I thought it was pretty well. They broke it down, so on and so forth. So, they have those tendencies, right? So, but I've used a lot of them. Like I used a whole bunch of them. Is it Taryn? It said, did you experience racism in the ICU? I could be blessed to say that I did not experience any racism in the ICU. However, I can tell you right now, I did experience like sexism in the ICU because I was the only guy on nights. On top of being the only guy, I was the only black person on nights as well. Commission now are still enlisted. I just got my RN BSN and I'm going back to the reserves next month. Zach, we should probably talk, man. But right now I'm still enlisted. I'm a HM1. And unfortunately, I'm the LPO of my unit. So you know how that goes. But yeah, I'm in the reserves right now. But if you can commission, bro, just go ahead and do your thing. I'm already at the tail end of my career and I'm just ready to go. Interesting. Yep. Good review. You did 26 year LPN in South Carolina. Shout out to South Carolina. That's I got a lot of family that live over there. So shout out to you, Miss Terry. And I appreciate it. I wish I honestly, like I said, I wish I had a lot of reviews. I wish I utilized social media like this or even utilized it when I was in school, but I didn't. So I'm about to graduate nursing school. I'm thinking about the military. I want to be a CRNA eventually. Okay, Tyler, do that then. Do you. So if you're going to join the military, make sure you have your bachelor's. Any branch of service, they all have their pros and cons on where you want to go. If you want to be a CRNA, that ass needs to get strict. You need to get straight to an ICU. Doesn't matter which one. Surgical ICU, medical ICU, neuro, cardiovascular. That's where you need to go. Mana says, and also topics on fundamentals. I don't know what you mean. Did you ask a question? What do you recommend people use that is best study for NCLEX? So I just went through a whole bunch of them. So how long have you been licensed? 3.5 years. But I just went through a whole bunch of nursing reviews for NCLEX. Of course, I got mine, 7-day NCLEX course. And then you got, Mark Klimick, Picmonic, Kaplan, all kinds of other stuff that are out there. What do you think about anesthesiologist assistant? So an anesthesia assistant, I think that's actually pretty great. I'm not even gonna lie to you. Like essentially an anesthesia assistant is equivalent to like being a physician's assistant. You still gotta go, you gotta get accepted, you gotta go to school, you gotta do all that. And then you can go and do the job of the anesthesiologist. I want to be a CRNA too, but I'm starting in the CV step down. So there's nothing wrong with that, Taryn. There's nothing wrong with starting in step down. So a lot of people are just like, oh, I got to start here. I got to go to med surg and blah, blah, blah. Like, dude, trust me. I got you. I get that. I get that 100%. But it's okay. There's nothing wrong with you going there to get that experience. I promise you. Maribel says, can you give me advice on going back to studying for LVN? It's been a couple years. Go, apply, and do it. Apply to as many accredited programs as they have out there and go do it. I don't want to hear nothing about your age. I don't want to hear it. I don't want to hear nothing about your age. I don't want to hear, oh my God, it's been 20 years since I've been to school. Don't know. Don't care. If you want to do it, go make it happen. There's another thing. Hey, for people that hang out with me, y'all know I don't coddle. I don't coddle you. I'm like, hey, go make it happen. H1 as well, working on my commissioning for next year. Hopefully, I wish I had known about your stuff. No worries, but bro, trust me when I tell you, no worries. No worries at all. I am trying to pursue that, but I don't know if it's worth it. And do I also take the same steps as a nurse too? I don't even know. Wait, what was your question? Is it star, whatever your thing is? You want to pursue what? You got to give me a little bit more context than that. I'm a star boy. I'm trying to pursue. Oh, anesthesia assistant. So, like you can, like for anesthesia assistant, you could just apply for it. But I believe you have to go to school, do the prerequisites for that school, and then apply. Keep up the good work. I appreciate it. Hey, this is what I love to do. What's the biggest thing new grads struggle with? Everything. They struggle with, so as a new grad, you're going to have imposter syndrome. Everybody that starts in a new career everywhere, it doesn't matter who you are, everybody's trying to find their way. They're trying to find their way in. Everybody has imposter syndrome because, you have people that have been there, right? It's the truth. It happens, But the one thing I'm going to tell you is that with time, it will get better. But be a sponge, take down as many notes as you can, all that stuff. But it takes time. It does take time. And it usually, I'm telling you right now, you usually don't get through imposter syndrome probably until you hit like your ninth month to like 1 year. Trust me, your first 3 to 6 months are going to be rough, but that's okay. It's a part of the process. So accept the process for what it is, but then understand why it's that way and make it better for yourself and then for people that are going to be behind you. Tips about ABGs for RT school. The biggest thing is that knowing for your arterial blood gases, the biggest thing is just knowing when they're out of range, memorizing them, number one, and then knowing what type of disease processes come after that. God loves me. Look, all day, every day. All day, every day. What about the new NCLEX test? What about it? What about it? KT TikTok? So one of the biggest things that I'm glad that I just saw that. So one of the time management, yes, time management is the biggest thing because you're gonna have to prioritize who you're gonna see first. It's not a joke. There's a reason why it's put in there. There's a reason why it's put in the NCLEX because you need to know who you need to go see first. But then you have to also time manage the tasks that come with each patient: meds, PT, case management, If you have an irate patient, if you have code browns, you know what I'm saying? If they're shitting all over the place, you know what I'm saying? So like these things are real. Delegation, especially if you're going to be the RN and you're going to be in the team concept. I worked in the ICU and they didn't have LPNs there and we didn't have any techs and I worked nights. So I didn't have to delegate anything to anybody unless like X-ray or PT came in and I was just like, hey, y'all do this or hey, y'all are, so on and so forth, right? Does your study guide go over the new generation NCLEX form or does it matter? So I am working on my new generation NCLEX slides. So where I just went through the forum, how I just did it like that, where I go through questions, I break the questions down, keywords, what to look out for. That is literally in the process of being created right now. Well, not right now, but obviously I'm not right here, but like right now. And that is going up here within the next couple of weeks. I still have to shoot the video and I have to edit it and all this other stuff, but that's going up like that on top of the actual in another review aspect where I do questions from the 8 sections of the NCLEX pie, if that makes sense, right? So for pharmacology and parenteral therapies, management of care, physiological adaptation, psychosocial health promotions, like trust me, my course is only going to be $48 until that's done, and then it's going up. I promise you. I'm telling y'all that right now. Which medical career pays the highest with the least amount of school, in your opinion? I couldn't even tell you because all of them you're gonna pay with some time. You're gonna pay with some time. Highest paid medical career, I think it's a radiologist, and they make like $350 like salary based, like anywhere $350 like $1,000. On the nursing aspect, it's a CRNA. They make depending on where they live, they can make $100 or $250 to $300,000 a year. But you're gonna be working for that, and I'm trying to tell you, highest paid medical positions with the least of school. I'm trying to tell you right now that shit ain't easy. It is not easy at all. Terrence said, "I'm scared. I start in 24. Don't be scared. You weren't scared to do the prereqs. You weren't scared to do nothing else. So don't be scared. Understand that's the process. Where do we get your study guide? My study guide, go check the link in my bio. And once you click the link, it'll be right there at the top. It'll say 7-day NCLEX course. Kelsey says, any interview tips for new grads right out of school? I would definitely write down any questions that you have. Write them down like in a little notebook. Because one of the things that they're going to ask you is, do you have any questions for me? Yep. Turn right back around and ask them. Ask them like, I don't know, like interview questions per se. I had like a notebook with all these questions. I wish I could, if I find it, I'll go through it. And then, the biggest thing is just to go and to be ready to learn, especially if you're a new grad. Be ready to learn. Be ready to learn. Stan Gal, girl, I see you up in here liking and shattering that like button. I see you out there. Ask what the culture like. Yeah, ask what the culture's like. Right? Ask what it's like. Because I can tell you right now, some units are better than others. Some units are toxic as fuck, and some other ones are they're just not good. I'm telling you right now. Like I've been on some units where all you hear is just this catty shit, and I can't. I'm first of all, I'm a grown ass man, and I can't do that. Patient to nurse ratio is huge. That one's on patient safety. Patient safety. Patient nurse ratios safety. If you go and you look at my video on why I quit the ICU, I've done 6. I'm working on number 7 right now, and it's a long one. You'll see why I quit the ICU. There's so many just, Ask them about their orientation length. Ask them about their training. Ask them about how long you're going to have a preceptor. Are you going to have the same preceptor? Is there continuity with the team? You feel me? That's what you need to be. Those are the type of questions that you need to ask. They always say we're a family. I'm telling you right now that it's nope. Taryn, nope. No. Chelsea says, thank you, ma'am. You are very, very welcome. You are very welcome. All right. Let's see. What else y'all got? What other questions y'all got? Hey, shout out to all the 85 people that are in here rocking with me. As a matter of fact, I'm going to do something real quick. Hey, don't go nowhere. Don't go nowhere. Give me like 2 minutes. There's something I have to do. Don't go nowhere. Stay. Oh, I ain't even need 2 minutes. I ain't even need 2 minutes. Hey, what else y'all got? My man Zach, what you say? Look at how many. Look at how many openings they have too. My current workplace has so many openings at nights. That's another thing, Zach. I'm glad you brought that up. So here's another thing. They are going to force you to go to nights, and I'm telling you right now. I went to nights. I didn't like it. Now here's the great thing about going to nights is that you can learn, you get a lot of autonomy. Like you have a lot of like people leaving you alone and you kind of learning as you go and you're kind of by yourself. But me personally, I do not believe a new nurse should go there because you miss out on so much like really good training. You miss out on so much good training during the day, like when they do rounds, and having all the ancillary services there, like farm, PT, occupational therapy, case management. Like you miss out on all those people. So in my recommendation, I say go to days. And plus, trust me there's some people that are just night owls and they just love being on nights. They've been on nights for 20 years and that's just them and that's what they like to do. Cool. That's cool. Me? No. I don't really understand it. You don't really understand what? Oh, okay. Yeah, I'm trying to tell y'all. That's what I'm trying to tell y'all. Like they will put you on nights. I never understood that. Me, I was just like, all right, cool. Whatever. I worked as a corpsman. I worked in the ICU for, in a different spot and I'm cool. I'm all right going to nights. Nope. Because not all hospitals are built the same. They're not all built the same. They don't all work the same. They have different policies. Doctors do whatever the fuck they want. No. Lord, I'm starting off on nights. I'm just saying, I petitioned. I was just like, nope. I literally walked into my director's office and I was just like, hey, I hate this place and I quit. And she's like, oh my God. Why? And I was just like, I can't do it. And so and you're right, it is really hard to get a daytime position because the majority of the nurses that got daytime positions are nurses that have been there for a while and they worked their way to getting to days. Nope. I had such alarm fatigue. Like my days and my weeks and everything were just thrown off. Like we as people naturally are not supposed to be up at night. Like we're not. And so it's just like, for me, it's just like, it took away too much for me. Like, and especially like when I started to have my days off, I'm just like, all right, cool. I got days off. Oh shit. Now I got to go back. Now that my body's forcing me to reacclimate to being on days. No, can't do it. So, but what else y'all got? Shout out to y'all. I got 75 people up in here rocking with me. I appreciate you. Hey, so if you guys don't know, somebody asked about my background. Like I said, I've been in the Navy for 16 years. I've been a nurse for 3.5 years. I have worked in 3 ICUs. I worked in the burn ICU, a neuro ICU, and a medical ICU. All accumulation was like a year or a little over a year. I'm sorry. And, like I said, I worked a little bit in the PACU and then I went to the operating room. In the Navy, I was a surgical tech. I was an instructor and as a surgical tech as well. And then I taught, pre-hospital trauma and then a whole bunch of other courses that they had to include like BLS and stuff like that. So, that's a little bit about my background. I think I had somebody come up in here and tell me, they were like, you've been a nurse for 3 years. Who do you think you are teaching? And I'm just like, oops. Like, I didn't know that. I didn't know I personally bothered the fuck out of you, bro. Like, what you mean? So I'm just saying that's a little bit about me. But of course, I want to know a little about y'all. Abby. I'm sorry. Started on telling all night. Nope. Not no more. Not for me. Hey, just joined the live. Fab Life Style Boutique. You missed everything. You missed everything we had going on. I'm just saying. Hey, Aaron. Hello. Burn ICU sounds very interesting. I'm gonna tell you right now. I work. If you guys, like I said, you guys can go to all my social medias. And I worked at the Institute of Surgical Research in San Antonio. It's like the world renowned burn center. They have a burn team and all that stuff. And I worked there for about 6 months before I got off of active duty, and I loved it. Like, I loved the training that they gave. Like, it's a different breed. It's a different breed, and you learn a lot. Like, fast, like a whole lot. So. Husband is getting ready to retire from the Navy next month after 24 years. Cannot wait. I bet. Look, I'm at 16. I'm only going to 20. I'm done. Dunzo. Burn. Yeah, it's very interesting. So you're CCRN certified? I am not. I'm not CCRN certified. To be honest, those certificates are great just to have on your fucking jacket, in my opinion. Like, they don't hold as much weight as they used to, where hospitals would pay you more money or blah, 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 blah. They don't hold the weight. All it does is shows that, hey, you went and you took that test, which is great. I'm not knocking that, but they don't hold, like, it doesn't matter. Like, it doesn't put more money in your pocket. All it does is put more letters on your jacket, put more letters behind your name on top of, just something more that you can talk about. But I can tell you right now, Taryn, like, nobody's going to walk around here and be like, oh, I'm CCRN, bitch. What about you? Don't nobody do that. And I would recommend not doing that. Don't do that. Don't do that. Don't do that. Struggling to decide if I want to attend a local community college for my RN program. I don't know why. What's struggling to decide about that? I'm taking my boards on Thursday this week. Shout out to you, Miss Harper. Don't they keep them rooms like 90 degrees and you got to wear PPE? Oh my God. Yeah, they do. Depends on the rooms. It depends on the rooms. Like, I was doing a rotation as well. I was in the ICU as well in the OR. The OR is like 90 degrees. But about on average, the rooms were about 80. And you got to think, it's like you have the person's, their protective barrier is gone. They have no, thermal regulation. The skin's gone. So we got to keep it hot. Hey, they hot, I'm hot. I miss San Antonio. I loved work down there. I'm not even gonna lie, probably one of the best commands. My last command was Tri-Service Command. It says I'm the only ACLS on my unit and they make me travel with the patients the most. What are you talking about? Like, where do you go? Like, you travel outside the patient? Outside the patient. Like, do you travel like with the patient outside the hospital? That's for Danielle. Zach said, most of my coworkers have been EDERs for 15 plus years and they don't have their CE. And there's really no incentive to having it, bro. Like, I'm keeping it all the way real. Like, I was going to get my CCRN and that's all I want. Look, you couldn't tell me about not going to CRNA school. That's all I wanted. And then the next thing you know, my love and passion for critical care was just gone. I just was not a fan. I just stopped. And I realized that I love more of educating like this versus, doing the bedside stuff. And plus my body's old. It's old now. So I don't want to do that no more. But anyways, so education is a route that I want to go for myself. No, off the unit. Oh yeah, of course they're going to make your ACLS. They're on an event. Hey, guess what? Danielle, you're going. Word about the wait list. I already have a lot of student loans from my previous degree. Well, here's one thing I'll tell you is that don't just start applying everywhere. Apply everywhere. And so, and I guess I'll give you this thought process. This is for the Fabulous Lifestyle Boutique. Go out there and get your RN, get your experience, and then start taking traveling contracts and then work that ass off and then turn around and pay those student loans back. You want to know, those student loans ain't going nowhere. They ain't going nowhere. Go out there but you got to also, they have scholarships and all kinds of other stuff out there that you can apply for too. Ever worked neuro ICU? What's your experience? I did. I worked neuro and medical ICU. So we floated, like, our units were required to float between both of them. I thought neuro was cool. Neuro is a different beast because, obviously you're dealing a lot with, neurological disorders. So myasthenia gravis, stroke, Parkinson's, post-op craniotomies and stuff like that. Big fall risks. So, what is the PCU and HVU unit? What is the HVU? I've never heard of that. The PCU is it's like step down. CT, MRI, X-ray, echo, cath lab, all the places. Look, I'm sorry. Look, I can tell you right now, like I'm ACLS. And so like, there's plenty of times I had to take my COVID fucking patients down to an MRI or a CT scan, intubated and all. Let me tell you something right now. That shit isn't fun. And you don't got no help. They leave you by yourself. Taryn, no. There's your answer. Butterfly, hey. So go to a community college. So think about it. I'm not going to, first of all, you're a grown person and I'm not going to tell you what to do, but I will suggest things. It's all about verbiage. Weigh out your pros and cons. Weigh them out. What's it, going to a community college to go get an RN or to go get your associate's degree as an RN? Go to a private school to go get the same degree and license. You know what I'm saying? And here's the thing is like, once you get your RN, your AD and RN from a community college, it's the same RN degree or the same RN license that I have. Same one. Jeter 18 says progressive care usually takes more drips in patients that need more frequent monitoring. Yeah, so that's like step down. AA Ron said, I had to transport a patient in septic shock on pressors, intubated, vented, etc. to CT yesterday. That's great, ain't it? That's great. Let me tell you something, bro. I had a septic patient that came up. My very first exposure to a septic patient, and they left me by myself. They left me alone. Never. I mean, I had COVID patients. I've had all these other patients, but I never had a septic patient, and they left me by myself. And I'm like, well, this is really fucking crazy. Community college works so well for me. Paid little to nothing. Yep. Stop. Finna decline my offer. Look. Taryn, here's the thing. It's like, you got to get experience somewhere. You're welcome, Fab Life. You got to get experience somewhere. But me, no. Got my ADN, then plan to get my bachelor's through the hospital I signed a contract with. Well, Miss Butterfly, think about it like this: is you can go anywhere to get your bachelor's. You don't have to, and your hospital doesn't have to pay for it unless you really love your hospital. The reason I don't like getting in contracts with hospitals because it's just like, man, if I want to leave, then you got to turn around and you got to pay them. It's like, but I can't really say anything because like my first job. After, my first nursing job, like official nursing job was, under a 2-year contract because of their residency. But their residency was fucking trash. Sorry. And I don't care what nobody says because it's the truth. So as long as they teach you what you need to prepare for NCLEX, it's all the same. Yeah, I would agree. Because in reality, it's all about it. So the material it's all the same. It's all about how the material is delivered and how you as the student receive it. I can literally tell you a way to remember, metabolic acidosis, but that shit would go right over your fucking head. And this isn't to me to direct this towards Jeter, but this is just a general statement. I may not be your cup of tea. You know what I'm saying? You may like nurse Marlene Hurst in her review. I think that her review is good, but her country ass accent, that's an environmental barrier for me, and I can't get through it. That's just me though. I still don't shit on the review. I think the material is great. So yeah, mine's 2 years. Yeah, Taryn, I know it is. What do you suggest? What do you suggest me to do? Wait, what? What do you suggest me to do for me to get my job? To get my bachelor's. Huh? Can you restate that? Hey, shout out to all 50 y'all rocking with me. If you guys are new here, I just decided to want to hang out. My name's Kevin. I go by the Boot Nurse. The Boot Nurse. It's a noun, by the way. And also don't forget, as a boot nurse, you're target to hazing. I'm just saying. Because you are a target of hazing as the new nurse, aka that nurses eat your young shit. They're going to be like, how do you not know that? Oh, you should know that you went to school, right? Look, let me tell you something right now. I don't do well with people that do stupid shit like that. I promise you. I promise you. There have been many nurses that I have cussed out on the floors that I work on. Well, maybe like 2 or 3 that talk to me like they lost their goddamn mind. So that's another thing. Be prepared. Be prepared for that because it still happens. It still happens, y'all. It still happens. Thank you, Kevin, for all the information. Ma'am, you are welcome. Ever thought about becoming an MP? I did. Poquito. I did think about that, but it's like nurse practitioner is not really for me. Not anymore. Like the CRNA route I was all about. And then I was like, you know what? I can go and I'll do MP. But then I realized I don't want to go that route anymore. Like I love teaching. I love giving out information. I love, watching people just aha moment. Like where people are telling me like Fab Life, she said, thank you for all this information. That makes me happy that she has this information now, because now you can't say that the information wasn't given to you. So go forth and do with it what you will. You know what I mean? But no MP for me. What do you suggest I do so that I get my bachelor's free through my job without having to sign a contract? I can tell you right now, there's nowhere that where you're going to get your bachelor's degree for free. And your job's either going to make you pay it. Your job is going to make you pay them back with time, or you're going to have to come out of pocket and pay for it. So true. I'm in nursing school, thinking of education more than MP. If that's where your heart lies, do it. What are your thoughts on nursing informatics? I actually was weighing for a very long time on if I wanted to do nursing informatics or if I wanted to do nursing education. Nursing informatics is great, in my opinion, because that is where nursing is going for the technology and the information stage. Like, informatics has to do a lot with, the electronic charting, home health, how they have the interpreters that are on iPads. That's nursing informatics, whether people want to believe that or not, because I literally, like, a patient can get on there and be like, oh, I need to refill my meds. Pops up. We talk about it. They say, hey, I need to refill my meds. There's a nurse on the other line doing telehealth, doing the chart, referring it to the doctor. The doctor is just like, yeah, let's refill those meds, yada, yada, yada. Or if it's a nurse practitioner, right? So informatics is great because that's the direction that we're going. That's the direction that we've been in, and that's where we're going. So I was waiting on that for a long time, but I decided to do the education route because that's just more for me, more my speed. But Tina, you'll figure that out. You'll figure that out for yourself. I want wireless EK. Look, Aaron, first of all, sir, you're asking for a lot. Okay? You're asking for a lot. Trust me, that was one of my, it's just like, bro, like, why I got to have these 12 leads? Like, why? Like, why? Like, think about what do they call them? The Kuros caps or the alcohol caps. Somebody got rich as fuck by putting alcohol inside of caps. The ones that we put on central lines and everything, bro. We can do it. We can do it, bro. We can make Bluetooth wireless EKGs, baby. We can make it happen. I'm just saying. And then also, what's it? You guys can look in. They have so many different scholarships, and they have those online programs. Like, WGU is one of them. I think Capella's another one. Chamberlain. I think they have a hybrid program. Look into those schools. I'm in a master's for education because I love teaching, but I love tech as well. I'm in my current role. Hey, shout out to you. Informatics would make my current role easier. Yep, it will. Hey, Aaron, dead ass. Look, I'm trying to tell you, if somebody can make billions of dollars off of a Kuros cap, bro, so we don't have, central line borne infections, for central and all that, for what are they, CLAPSIs? I'm trying to tell you, bro, we could do it. But, okay, so you're doing education and you're doing informatics. Okay. My whole goal is to still teach. Like, I want to be an adjunct instructor and teach, like what it's like in a hospital, but then also teach the real world aspect of nursing. And I want to teach, and I want to tell people that. Like, I don't want to paint a picture like, like all these schools are just like, come to our school, be a nurse. It's great. It is great. Right. But I'm gonna need for you to know what's up. It was weird. Like the first day I got to bedside, I was like, all right, cool. what is my phone? What's my exit strategy? How does your boy get out of here? You know what I'm saying? So nurse corps, full tuition plus stipend. What nurse corps? We're talking about the Navy, talking about the Army, talking about the Marine, the Air Force. Yeah, they'll pay full tuition and they'll pay stipend. Or what is it? The nurse candidate program. The nurse candidate program will pay for you to go to nursing school to get your bachelor's. That's through the Navy. I don't know about the Army scholarship or the Air Force scholarship. Hey, man, I was on your live during your session and studying. Just wanted to say what's up. Hey, we talked yesterday, right, Jimmy? You said you was going to be there. I assume you were going to be there getting your study on. So I appreciate you popping in. Kevin, maybe you can go to high school talks and talk to the kids. I have actually thought about that. I actually do go to the local college and I talk to a few classes of LVN students. I do. So I do that currently. But, my goal, because I like to teach and I'm really honing in on my public speaking. So I would really like to do like public speaking gigs in regards to nursing and stuff like that too. So all in due time, though. All in due time. Come to Delaware and talk to the schools. Hey, Jimmy, if you could be that gap, to bridge that gap in between there, bro, I might. Oh, man. Hey, that's what I wanted to tell y'all. So I am going to be doing what is called a nursing summit. That's what I wanted to tell y'all, man. And I forgot. Hold on. Let me see if I can pull it up. I'm going to see if I can pull it up. So I'm going to be doing a nursing summit on, and I'm going to show you guys what it looks like right now as soon as I can get it up. Right. Kevin, when is your birthday? That's weird. It's in October. 100%. That's what they need. It's the perfect environment. They portray. Sometimes you got to pivot. Yeah, facts. I'm all about it. That's awesome. Here, let me show you guys. See if I can pull it up. See if it'll let me. Stop. All right. I'm gonna turn this around because I want y'all to see this. Hey, as a matter of fact, everybody need to go over to my Instagram right now, and it's in my stories. So what I'm going to be doing is I'm going to be doing a virtual summit, and it's put on by Picmonic and another company called TrueLearn, and they're calling it the Nursing School Summit. And there are 5 of us that are going to be doing it. Okay, let me see if I can turn it around. So flip the camera around. So yeah, there we go. I think you guys can see that, right? I think we can see that. Here, let's see. I think we can see that, right? So check that out. So I got this sent to me today. So what we're going to be doing, I'm going to see if it'll take me there. Will it take me there? Take me there. I'll be there. All right, let's see. All right. It might not take me there. But yeah, so will it take me there? Take me there. Oh, it's only taking me to Instagram. Anyways, so here we go. So essentially what they're going to be doing, it's going to be a nursing summit, and they're going to talk about navigating nursing school. They're going to talk about building your resume, getting ready for the new generation NCLEX, and landing your career job. And that's going to be October 1st, right? And I'm telling y'all right now, guess which one I'm doing? This one. That's the one I'm doing. All right. So I would recommend everybody go over there and you guys sign up, because especially depending on where you are in your nursing journey. So like if you're about to start school or if you're about to start a job, like navigating nursing school, especially if you just started, super helpful. Landing your career job, awesome. Getting ready for NCLEX, great. Building your resume, this is super important. One easy way to build your resume is ChatGPT. Just saying, just throwing that out there. So let me go and see if they have. Yeah, here's their link tree, and let's see. I think this is it. Yeah. So here it is right here. I know that's probably a lot for y'all. I think it might be too tiny. All right. So there's that, and so here's the times, and so here's mine right here, y'all. Look, check it out. Boom, money, right there, right, and then here are the presenters. Right. So here are your speakers. You got Morgan Lima. You got Sandra Wong. You got me. I do not want to butcher her name. and then you have Ashley Atkins, right? And then they're going to be talking about NCLEX. She's a nurse practitioner student. She has a podcast called the Teachable Nurse Podcast. She's the founder of Choosing Nursing, and then just all kinds of stuff. And there's bios for everybody. All right. So y'all should definitely go over there and check that out. I knew that I missed something. They sent it to me like right before I did the live. So I just wanted to give everybody that opportunity. And then when I get on here on Wednesday as well, I'm going to talk about it as well, because I want everybody to, to use that opportunity for them to get more education for themselves. All right. So shout out to all 36 of y'all rock with me. I think I'll hang out probably for like another 20 minutes. But if you guys are just here, I appreciate everybody that came to the live. My name's Kevin. I go by The Boot Nurse. Oh, by the way, if you guys want this shirt, just go to my website, thebootnurse.com, and then go up to the store. It'll take you right there. And then there's different shirts on there and stuff like that. So go over there and get you a shirt. You know what I'm saying? So I want to know who you are, where you're from, where you're at in your nursing journey. What questions do you have? Did you take the NCLEX? We had one person come in here who passed their NCLEX. Some people that are taking their NCLEX here in the next couple days. So where are we at? What are we talking about? Which I want to know. Y'all got 19 minutes. Y'all got 19 minutes. Let's see. Just signed up. Okay. All right. What are we talking about? Is that Momo F6? Uh-oh. There he is, y'all. The co-host back there doing something. Acting a fool. Nurse Taylor. That name looked familiar. Appreciate y'all joining. Well, I don't think anybody has any more questions. I think everybody's all questioned out tonight. So I'll leave it at this. Be good to yourself. Be kind. I take, what does it say? Jessica Barnes says, I take you take what on? You take your NCLEX on Thursday. Okay. Hey, so on Wednesday, you don't need to be doing nothing NCLEX at all. Just take that day off. Relax. Try to relax as much as possible. That's what I'm gonna tell you. And I'm pretty sure I'm gonna say it. I'm gonna speak it into existence. I know that you've been studying really well. So if you don't know it by now, you don't know it at all. And that's the truth. And remember, it's not about memorization. It's all about making yourself familiar. Okay. Is it Carmel A? Any tips for the NCLEX? Well, one thing I'll say is recreate the testing environment for yourself. Put yourself on a strict schedule. Cut out everyone and everything that is not going to progressively push you towards your goal. I don't care who they are. I don't care if they're your mom. I'm not even playing. Study tips for the HESI exam. I would say that Saunders book. That's what I used. Put yourself on a manager time management. This is for Carmel. Time management, huge. So like, even if you have to audit yourself by putting it on a damn Excel spreadsheet, do it. And then audit your time. You're going to be like, well, I'm spending, 2 or 3 hours just scrolling through fucking TikTok while I'm on the toilet. I know the phone and TikTok is the new newspaper, but I really need to find out who Sarah is. Anyways, so think about that. And also think about those areas that you have the hardest time studying for. So like me, it was pharmacology. Put that shit on a damn calendar and then start studying pharmacology first and then start implementing your questions in between there. So, do, a couple of content videos for pharmacology and then do an 85 to 150 quiz, review it, remediate it, and then jump back in and do it on that rotation. Okay. All right. You're welcome. Let's see. Nurse Hub. Man, I forgot that I had Regina. I had like Remar nursing in my chat one day and I was surprised. Not me fangirling over her. But also a great review that she has. So, but all right. I think I'm done. I'm done enough talking for the day. I'm pretty sure my son is in here acting a fool. So I guess I should go spend time with him and be a dad or some shit. So, like I said, it takes nothing and it's free to be kind. Be good to yourself. Keep pushing. We're always thriving. That's what we're always doing. We're out here to thrive. I'm trying to be on my Coach Prime right now. trying to be on it. Do you have a Facebook group? I do have a Facebook group. If you go into the link in my bio and you'll see where it says the Boot Nation Facebook group, it'll take you directly there. Okay. But yeah, everybody's great. You guys are great. Remember, you're right where you're supposed to be. So, like I said, check out the 7-day NCLEX course. If you haven't, it's for $48. Once you get it, it is yours forever. Yeah, it's yours forever, all the way up until I put everything up in there. I mean, even if the more shit that I add, the more it's going to be there for you forever. It's eventually going to go away. So I would say, like I said, it's a hard flex to say, yeah, I got it for $48 as he was building it. And plus, y'all's direct feedback will tell me what other stuff to put in there for y'all and for other people that you feel would be really great. So, but yeah, hope everybody has a good rest of their day. I hope everybody has a good, safe rest of their next 2 days. And I will see everybody on Wednesday. So take care. Bye.